There's a serious trauma coming in.
She's T-boned the truck, yeah.
Air ambulance is on the way with a badly injured pregnant woman from country Victoria.
9:45, it's chopper.
On hand is emergency doctor Scott Taylor.
I'll take it.
Yep. We're expecting a lady who's been involved in a very high-speed car accident. We have to expect the worst, that this patient is unstable, may have some life or limb-threatening injuries.
With 2 lives that may need saving, Dr. Scott calls on the experience of Dr. Jonathan.
I need an extra set of hands. Would you like to help? No worries. All right, thanks, bye.
Oh my God. Okay, 24-year-old, 9:45. And early pregnancy as well.
Looks like we've got a bad car crash and a pregnant woman, and those 2 things are a bad combination.
On the rooftop, air ambulance touches down with the 24-year-old who was driving to work when her car collided with a truck at high speed. She's suffering multiple injuries and in excruciating pain.
That extra pain relief kicked in?
Not really. Feel more sick than anything.
Okay.
With such a badly injured patient, it's all hands on deck, with Dr. Scott taking the lead.
Caitlin, I'm Scott, one of the emergency specialists. We've got Jonathan, another one of the emergency specialists as well. He's going to do a quick ultrasound.
Okay.
There's going to be lots of voices, lots of loud voices and lots of people and lots of things happening. Just stop us at any point if you have any questions or things are a bit overwhelming, okay? All right. You're 9 weeks pregnant, is that right? Have you had an ultrasound to
Yeah, I had
confirm
one
that?
yesterday.
Okay, and everything?
Everything was fine.
Okay.
Caitlin, I'm Ebony. You okay?
Yeah.
Good stuff.
She's pregnant, which struck a bit of a chord with me being pregnant myself. You don't just think about one patient, there's also another patient involved, and that's the baby. So it's a very serious situation.
1, 2, 3.
Emergency nurse Ebony Lee Butterworth is protecting Caitlin's neck in case she has spinal injuries.
Across on 3. 1, 2, 3. Good job. There we are.
At 7:30 this morning, she's driving a late model SUV type vehicle on a 110 km/h freeway. A truck has pulled out into her and she's ploughed into the truck without having the chance to do much braking.
Sorry.
She's
From which
T-boned the truck.
T-boned a truck.
Significant damage to the front of her car has essentially been destroyed.
Terrified, Caitlin managed to drag herself from her mangled car before emergency services arrived.
She's got genital soreness across her tummy and some nasty abrasions from the seatbelt. Obvious swelling and deformity to her right femur with some shortening and rotation of her right leg. She's got a nasty lack to her left knee and an obvious closed fracture to her right wrist.
She doesn't look good and she's in pain. So what's happened inside? That's the thing. She might be bleeding internally, and that's what I'm worried about.
Dr. Jonathan quickly scans for any internal injuries that may be a risk to Caitlin's life and the life of her unborn baby.
Are you sore on this side of the chest?
Yeah.
Yeah. Sorry if it hurts. I'm just checking.
That's okay.
Just checking to make sure you haven't got a punctured lung. So there's blood everywhere. It's not much,
Yep,
but there is. And she's got the huge seatbelt sign.
Yep.
And there's the fetal business.
I can see blood inside her abdomen where it shouldn't be, and that means trouble. It means she's going to have some injuries in her abdomen, and that may have some implications on Caitlin's baby as well.
That hurts.
Sorry, that's sore.
Yeah.
Yeah, sorry about that.
Can you see any more detail?
Both Dr. Jonathan and Dr. Scott keep scanning, anxious to see any signs that the baby is still alive.
I don't know. Can you see anything going on there?
After 6 months working in the Royal Melbourne Hospital's intensive care unit, Emergency Registrar Dr. Andrew Wallace is happy to be back in the ED.
I feel most at home in the emergency department. I love the organised chaos of it. I love everyone pulling together for the same goal to try and help really sick patients.
Within minutes of hitting the ED floor, Dr. Andrew's first case comes in.
Royal Melbourne receiving, go ahead.
A 20-year-old male is travelling at 50 kilometres an hour
been ejected off his horse and has been trampled over the abdomen and right femur. Blood pressure is 54 on 30.
There's been a horrific accident at a racecourse just a few kilometres from the Royal Melbourne.
Royal Melbourne receiving, can you just repeat the blood pressure, please?
Blood pressure is 54 on 30.
There's a major trauma coming in. Jockey has fallen off his horse and then potentially been crushed. His injuries could be absolutely critical, completely life-changing. So we need to prepare a major response.
Okay, what do you want to do, Andrew?
Get the med pack prepared, consideration that it might be OPSTAT.
Yeah.
Dr. Andrew takes the lead, assisted by his mentor, Senior Emergency Doctor Jana Alexander.
X-ray and pelvic X-ray here and ready and waiting.
Paramedics are rushing in professional jockey Ethan, who has life-threatening injuries after falling off his horse in the middle of a race.
Stay setting a little bit. Are you okay? I'm going to just keep annoying you up here, okay?
Ethan's horse has shifted. It's fallen. He's got over the front of it. It's then rolled on top of him.
Yep.
They're complaining of right femur pain, abdo pain, and pelvic pain.
Most recent blood pressure?
55 on 40.
65 on 40.
Ethan's blood pressure is incredibly low. I'm really worried that he's got major organ damage. He's bleeding internally, and without intervention, he's quite likely to die.
Hi there. My name's Jana. I'm one of the emergency doctors, okay? I'm going to take good care of you. We're just going to get you over onto our bed now. All right? Okay.
On the count of 3, we're rolling all the way across.
Ethan's girlfriend Celine was at the racecourse when the horse tripped and rolled.
I just ran out onto the track where he was. It was about a 200-metre run and he was just pale yellow. His face was in shock. He just looked like he was going to die.
Fast scan.
Dr. Jana urgently scans, looking for internal bleeding that could be threatening Ethan's life.
So, gross B positive fast, left upper, right upper quadrant, pelvis.
Yep.
What I can see is free fluid in the abdomen. That means blood, which is extremely serious. It suggests that he's got solid organ injuries. It's extremely life-threatening and he needs an immediate blood transfusion if he's going to survive.
The priority is chasing the med pack, get the blood into him.
So I don't have palpable pulses when I just check.
But is he responding?
Ethan, can you open your eyes? Yeah.
Yeah, responding. Med pack, get in. Can we get red cells in?
Yeah.
Okay, we're a dedicated nurse on the med pack.
Can we get a nurse?
Yep, that's priority.
Ethan's blood pressure is plummeting. He's fading fast.
Andrew, we need to be pushing for an OPSTAT.
Yep, absolutely. Okay, so disposition's OPSTAT.
Calling OPSTAT is the highest level that we can do. It means that we need to get him to theatre immediately. We're measuring time we've got to save his life in minutes.
Priorities just now is getting the med pack in as soon as we can. We'll do that bilaterally.
Do we have a blood checking clinician for this side as well?
For this side as well.
I can do one side.
Yeah. Okay, great. Thank you. Sorry, did I get you?
No, you're fine.
Trying to get Ethan's blood pressure up, they pump blood into both arms.
Right, squeeze.
We're having to literally squeeze blood into him to get it in as quickly as possible.
Dr. Jana prepares for the worst.
Lauren, if we go into traumatic cardiac arrest, you're ready to go with decompression, and you can do both sides.
Ben, do you think you can squeeze because you've got lead on so we can get some x-rays?
Yep, go for it.
It's vital to get x-rays to see if Ethan has other serious injuries the surgeons need to know about.
Everyone who's not in lead, get out. Right. That's right, now pelvis.
Dr. Jana and Dr. Andrew quickly look for life-threatening injuries.
Okay, so it's going to be spleen or liver.
Looking at the x-rays, it's reassuring that he hasn't got an injury to the pelvis.
You're doing really well, okay? You've got some blood in your tummy, okay? So we think you probably have an injury to your spleen, maybe your liver, okay? But your blood pressure is very low, so they're going to take you upstairs.
You have to try and imagine how terrifying it must be to be extremely fit at the peak of your career and then all of a sudden you're flat on your back and you can't move your neck and they're scared. Just holding their hand or mentioning a few nice reassuring things can, have a huge, profound effect.
But you're safe, we're going to take really good care of you, okay?
How far away theatre are we?
I can take him, we've got a theatre, we've got...
Right, okay. FFP next bag, left side. So we've done 3 red cells. Lynn, next pack, FFP.
Even though Ethan has been given more than 6 bags of blood, he's deteriorating rapidly.
We're just buying him time. If we don't stop the blood flowing out, all his organs are going to suffer, his heart, his brain, everything. He's going to die within minutes.
So once we've got ketamine and once we've got the yellow drug bag, we should be good to go.
We've got a drug bag. We're ready to go.
Right, okay.
You're coming up. Andrew, I'll go up with them.
Okay.
Dr. Jana stays with Ethan to make sure he survives the trip to theatre, where surgeons will try to stop the internal bleeding.
We've done everything we can for Ethan in our emergency department. We're now leaving it to the trauma surgeons to save his life.
So there's blood everywhere. Right upper quadrant, left upper quadrant.
24-year-old pregnant Caitlin has multiple injuries from a high-speed car crash, but it's internal bleeding that has Dr. Scott and Dr. Jonathan worried.
Can you see any more detail?
They're trying to see signs that Caitlin's baby is alive.
I don't know. Can you see anything going on there?
I'm trying to find the fetal heartbeat. The pressure's really on. I've got a bad feeling about this.
There. That's it.
It's a tiny little pop, pop, pop,
Yeah,
pop.
do you want to just fan
It's like a
through?
moving target.
Seeing that heartbeat was such a relief for us and also for Caitlin.
We can see your little baby in there.
Yeah.
Yeah, but that's all I can say. You know, you've had a nasty blow there. You've got a little bit of fluid in your tummy, which means you've got some bruising and stuff going on in there. And we're going to see where that's coming from. All right?
Tiny little baby in there, in a nice big bag of fluid and inside her uterus or womb. We'd need to worry more about her other organs than the baby.
Do you have any other kids?
No.
This is your first bub?
Yep.
It's very exciting.
Yeah.
As Caitlin's car crashed into the truck, her first thoughts were of her fiancé Riley, who is now on his way.
When she had the incident, she actually rang me. I answered and she's screaming my name, help. Got there and it was real daunting, seeing the car, and immediately thought the worst. She wasn't going to be there. She wasn't going to be with us.
Okay, so team, we're ready for some x-rays. Ebs, do you need a little bit longer there?
I'll just pause and come back.
Caitlin urgently needs x-rays and a scan to see what other injuries she has and to find the source of her internal bleeding.
So she's early pregnancy, but we have to scan her anyway. Yeah. That's the bottom line. Yeah. Not ideal, but it's what we have to do.
We treat mum like she's not pregnant. We're looking for a number of life-threatening injuries. Those injuries will hurt the baby way more than any x-ray we give the baby.
X-ray.
As the day progresses, the number of trauma calls is increasing.
Hi, it's Jason.
Senior emergency doctor Jason Gabriel Anyusor has been part of the ED team for 7 years and thrives on the unexpected.
It's already shaping up to be a very busy day that can make things more interesting and exciting, and every patient is different.
Dr. Jason's next patient, Manon, has arrived into a trauma bay.
Do you want to do head, Jana, or
Yes, I'll do head.
The 27-year-old bartender was badly injured when her motorbike crashed into a truck. She's been given the green whistle for pain relief, but is still in agony.
Ready? 1, 2, 3.
We'll go very
Don't
slowly.
move.
Sorry. There we go. There we go. Okay.
Emergency nurse Gigi Ferrer is known for his ability to put patients at ease.
There we go.
Oh, that was good.
That was nice and smooth. How are you going there, Manon?
I think nursing is so special. I get this opportunity to be some sort of comfort or some sort of human connection for these people who are really suffering and going through quite a lot.
Manon?
Yeah?
Do you have any allergies to medication?
Penicillin.
Okay, all right.
Hello, Manon.
Hello.
My name's Jason. I'm one of the doctors.
Okay.
Do you remember what happened?
Yes, I was on my motorbike
Mm-hmm.
and I hurt a truck.
Did you lose consciousness?
Yes.
You did?
Yes, during like 2 minutes.
Okay.
Yeah.
She was driving a moped, travelling at approximately 50 kilometres an hour. She's then, seems like lost control over a bit of water on the road.
Yeah.
And then collided into the rear end of a parked truck. So you can imagine the truck, the steel bit comes across like here, The moped's actually ended up like kind of jammed in under it.
Both deformed?
Yeah, significant. Yep.
With the speed that Manon's come off her motorbike and loss of consciousness, I need to exclude an intracranial injury. So we need to get some scans, but before that, we really need to get her pain better managed. We'll go with some fentanyl and IV paracetamol.
Oh, beauty.
It's going to be doing some x-rays quickly for you, so I need you to be very still, yeah?
Okay.
As the pain medication takes effect, they can start to examine Manon's badly damaged wrists.
I can just turn your hand just a little bit.
Manon arrived alone in Australia 3 weeks ago on a 12-month working visa, leaving family and friends back in France.
My contact person, it is my husband.
And what's his name?
It is Joris.
The trauma team makes sure her husband in Paris knows what's happening.
0202.
With Manon being so young and being so far from home, I think it struck a chord with me.
So you're here on holiday?
No, for working.
Ah, what did you do for work?
Working holiday visa.
Yes.
And I'm bartender.
Oh, nice.
She's alone, you know, and she's meant to be having the time of life, and she's here instead in an emergency.
What's your favourite cocktail to make?
I have a lot, but I like Negroni.
I love Negroni. Spagliato.
You like it? Oh, you like it? You do? You know this cocktail?
Of course I do.
Okay.
It's not my first rodeo.
Manon's x-rays have come through and the results are alarming.
This is her right wrist, so she's broken across the bigger bone in her wrist. It's moved off. And then on the left, that wrist is broken, and you could see that it was a bit more deformed compared to the other one, because you can see where that fracture is. It seems to be completely off the end of the bone. To improve her pain, we need to try and get the bones as realigned as possible. It requires a lot of force to reduce these type of fractures, and it can look quite confronting to people who aren't aware of exactly what we're trying to achieve. It's 25 of ketamine.
Gonna feel very good shortly, I promise, Manon.
Okay.
It's a fine line. I try to get the dose right. I don't want someone awake and aware, but I don't want to give them so much medication that they stop breathing. How you doing, Manon? Manon?
Yes?
How are you feeling?
Good.
You guys happy?
Yeah, we're ready.
Are you going to do left then right?
We'll do left, then we'll do right after that.
It is almost a bit like playing tug of war on her arm and her wrist to try and pull those bones back out to the proper position.
I can see that she is suffering at the moment. It is difficult to watch, but by doing this pretty intense procedure, we want to put the bones back into place so that pain is then minimised after this, and so it gives it a chance for the healing process to start.
You're doing well, Manon.
Manon's pain is extreme.
And that's just another 25 of ketamine.
Dr. Jason slowly increases the medication, making sure she doesn't stop breathing.
You just gotta go to space, Manon.
Okay.
I'm not too convinced at how well that drip is working.
Yeah.
It's a problem with broken arms that the drips are round about where we're trying to put plasters and pull on her arm. Trying to get a second drip into her.
You're okay.
You okay?
Yeah, you're good.
Okay.
You're very good. It's okay.
So she's a bit dissociated, but not enough.
Not enough, yeah.
Dr. Jason is trying to give just enough sedation so they can stabilise Manon's wrists without causing pain.
30 of ketamine, Jane.
Another 30?
Yeah.
It's okay, Manon. The medicine will work soon, I promise.
Okay.
Yeah. It's coming in now, okay?
Okay.
You're doing very well.
And another 30.
That's 130 Ula.
Yes. Ketamine is a drug where people are actually still awake, but they're often not aware of what's happening. We are giving Manon a decent dose, but that's still not quite cutting it for her.
24-year-old pregnant Caitlin has multiple injuries after a horrifying car crash. The team managed to see the baby's heart beating, but X-rays have everyone concerned.
There's blood everywhere. It's actually more around the spleen than around the liver. There's no pneumothorax on the right. It's just whether there's a little bit of fluid on the right lung.
Okay.
She's got some internal bleeding, and it turns out she's got an injury to her spleen. The spleen has been shaken around, it's bled a little bit around.
As more X-rays are taken, Nurse Ebony lightens the moment.
Excuse me.
Yeah, okay.
Huh?
Is you all right there?
Hiccups.
Okay.
Take a big breath. Big breath and hold it.
Me?
Yes.
Oh, I just have these spontaneous hiccups all the time.
Big breath and hold it.
Stand on your head.
Drink
All
water.
these funny
Drink
things.
water upside down.
We see so much awfulness all the time that any moment you can make light of the situation, we'll take the opportunity to do so. It relieves some of the pent-up stress that builds up in our job.
Excuse me.
X-ray results give Dr. Jonathan the information he needs.
You've definitely got a broken leg from what we think.
Yeah.
That'll need an operation.
Yep.
And you may yet need an operation on your tummy, depending on what we see there. Yeah, because you do have some blood in there. We'll see what that looks like with the scanner.
We've got a pregnant trauma in trauma 2 at the moment. We're hoping to get round for a CT pan scan ASAP.
We've made a decision that, given Caitlin's currently stable, to put her through a CT scanner to figure out what exactly her internal injuries are.
I'll be there shortly.
Was your forearm, was it all bent and out of place?
My wrist was bent. It was bent inwards.
Yeah, you've probably broken both the bones in your arm, I think. Yeah,
It definitely
sorry.
hurts along like all of my palm.
I am sure. We can fix that though.
I keep looking at Caitlin and thinking, gosh, this girl is like so incredible. She's so brave and so stoic, coping with such a horrendous and scary situation.
It's a bit of a shitty day.
Yeah.
You're dealing with it very well, though.
Thanks.
Caitlin's fiance Riley is still travelling to be with her. It's a lot for Caitlin to deal with on her own.
Did Jonathan talk to you any more about the ultrasound and your baby?
No.
Okay, we thinks you can see a heartbeat there. We'll have a proper look a little bit later on.
Yeah.
There's not much we can do at the moment.
Yeah.
The best thing we can do is look after you properly.
Yeah, 100%.
All right, and then that will give baby the best chance of being okay.
Yeah.
All right, we
Yes.
ready, are we?
Yes, we're ready.
So we still don't know what's happening at this stage, and it's really important that we get to CT ASAP so that we can ensure that there's nothing sinister happening inside.
All right, just be mindful, we've got a femur fracture on the right. We're gonna roll on 3. 1, 2, 3.
24-year-old car crash victim Caitlin is about to be scanned for multiple injuries after her car smashed into a truck.
Is that petrol?
Yeah.
The pregnant woman managed to pull herself from the smoking wreckage before help arrived.
She is covered in petrol.
I notice that she's wet and I get this overwhelming smell of fumes.
2, 3.
Oh my God, this situation is not only so bad that she's had this car accident, but this car could have burst into flames. That's left me in absolute shock.
Dr. Scott is hoping the scans will rule out any serious internal injuries.
Okay, and we'll have a chat about your scans when we get back. We'll just have a closer look. All right, thanks everybody.
It's an anxious time for Caitlin, waiting to know what other injuries she might have.
You all right? You feeling sick?
Good. Her chest looks okay. She's got contained hematoma in her spleen.
We're looking for any major injuries that may not be picked up on that first ultrasound scan.
Oh, yeah.
Following that, we're looking at an X-ray of her right thigh, which shows that she's got a pretty extensive multi-part fracture of her femur.
Dr. Scott now has the full picture of Caitlin's injuries.
Had a few things kind of happening around you. There's a bit of bruising around your spleen.
Yeah.
We can't see anything that's actively bleeding at the moment.
Yeah.
Your wrist is broken in a couple of places.
Yeah.
and we'll need to straighten that out. Your thigh bone broken in a few pieces.
Yep.
That'll need a rod
Yep.
put through it. That wound on your left knee seems to go into the joint.
Yep.
So that'll need a skin graft or a special kind of dressing over the top.
As the full extent of her injuries sink in, Caitlin's mum Sally and fiancé Riley finally arrive.
Pelvis? Fine.
Fine.
Pelvis
Baby?
is fine. Still a heartbeat.
Cool.
Yeah. Yeah.
How are you feeling? Like I got hit by a truck. How's your pain? But yeah, as soon as I hit it.
You hit the fuel tank of the truck.
Yeah, I know.
Yeah, she
felt
was
it.
covered in
Diesel. Diesel, was she? But then the car caught fire. So I got myself out.
Half in, half
Yeah,
out.
so I undid my seatbelt and I opened the car and I fell out the car.
Ugh.
And I didn't get moved till the paramedics came.
Far out.
It could have been so much worse. Oh, yeah. Like, I feel very lucky that I've only done damage on, not minor parts, but definitely could have been so much worse. Like, it could have just killed me.
Caitlin's got a pretty big journey ahead of her. She's got lots of broken bones that are going to need extensive surgeries. We also don't know how this pregnancy is going to work out. It's going to be a journey of weeks and months, I fear.
So this is green.
Oh, well, we're all super abundant, aren't we?
Yeah.
Senior emergency doctor Martin Dutch is starting his shift trying to find out who's on his trauma team this afternoon.
What team are you on today?
Green.
Green. Excellent. Well, I'll have nothing to do with you.
Yeah.
I'm on purple.
Okay.
I'm looking for purple people.
We have a number of doctors working at any one time, and we form teams. In this case, the purple team and the green team. That team report up to me.
Hi, Jana. Martin, come with me.
Royal Melbourne receiving.
The pace at the ED is not letting up.
Through coming through the with a 21-year-old male passenger in the car. Our patient has been hit approximately 50 kilometres per hour. He's gone over the bonnet and then landed on the road.
Paramedics arrive with the young Japanese student who's in a lot of pain after being hit by a car as he crossed a city street.
Something about being painful.
Worried that Takaki has a head injury, Dr. Martin's first priority is to see how alert he is.
Hello. How are you feeling?
I'm so scared.
You're scared. It's okay. There's a lot of people around.
Takaki told me that he was scared. That's a very human reaction. He's a long way from home, and having a serious event where he's hit by a car and taken into a large hospital, I can only imagine would be very, very frightening for him.
He's been hit on his left side, rolling over onto the bonnet, approximately 60 k's an hour. He's gone from the bonnet to the floor and has hit his face front first. He's got some pain to his left shoulder where there's bruising and swelling.
One of the things I worry about when somebody has been hit at 60 kilometres an hour is life-threatening injuries potentially to the head, to the chest, to the abdomen. These are the sort of devastating life events that can change someone's life forever.
Takaki arrived at emergency with his friend Koshim, who was with him when he was hit.
We might just get this guy to sit up in the left-hand side of the room and he can interpret for us. I'm a little bit worried about your shoulder. I think you may have broken a bone in there, maybe. We'll take an X-ray and have a look.
Is it scan?
Yeah, scan.
Is it not the pain?
The scan is not painful, no.
It is not electric.
What is not electric?
更新。電気流すやつあるやん、パーンって。
Open your eyes and look up at the roof.
shock?
No, we don't do electric shocks here. Okay, he's in hospital. We'll take care of him.
What language do you speak?
Japanese.
Japanese.
We might need to do a little phone interpreter because
Yeah.
I think even our interpreter is struggling.
Emergency nurse Sarah Thomas turns to technology to get around the language barrier.
I need to tell Takaki what's going on right now because he's afraid.
Can you see?
Yes, okay.
So any online communication tools I'll use just to reassure him that we're going to figure out what's wrong with him and we're going to help him.
Sorry. Big breath in.
So the good news for Takaki is that both of his lungs are working normally and there's no life-threatening bleeding inside his abdomen.
Lots of pain up here? Yeah, it looks sore.
He's still being hit by a car at 60 kilometres an hour. We need to screen to see if there are any underlying injuries that we need to attend to.
So I'm going to get an X-ray of your chest and an X-ray of your hips.
You have already scanned?
Not yet.
See, I don't think the brain is working that well.
No.
I'm increasingly concerned about what's going on with Takaki. He's at the least concussed, but there may be something even more serious going on inside his head.
All right, Manon, we're almost there, OK? We're almost there.
In the emergency department, French traveller Manon has 2 badly broken wrists.
My God!
The team are pulling them back into place before plastering.
Seems dissociated and sleepy, but they're not tolerating the reduction too well.
Dr. Jason is trying to get her pain under control.
I've given her a big dose of this first drug. Doesn't seem to be doing as much for her as I'd like, so going to add in a second powerful drug as well to help sedate her more, to tolerate the procedure. I think we'll go with some propofol.
Oh my God.
With even stronger medication, finally they are able to straighten and plaster Manon's arm.
How you going there, Manon?
Yeah,
You good?
I'm good.
You are good, yes.
I'm super.
Yeah? You're super high.
I'm super high.
That's OK. That's where we want you to be.
Okay.
Just gonna do your right arm now, OK? You just relax. You're OK.
Okay.
You're OK, Manon.
What's wrong?
While she seems distressed, the combination of the medications means that when she wakes up, she won't remember any of this.
Like, how?
Everything's OK.
With Manon fully sedated, they can now set her other arm in place.
Everything's good, Manon. There we go.
All done. Very well done.
Thank you, team.
You OK, Manon? You did very well. Do you have much pain at the moment, or...? No? OK.
It's okay.
Good, good. Are you enjoying the high?
Yes.
Yes, good.
This is a significant injury, and Manon is going to need some surgery to repair both of her wrists so she can have proper function of her hands going forward. She's a young lady still with a long working life ahead of her.
If I'm right, this is snapped in 2. It's going to be sore.
In Resus Bay 4, Dr. Martin and Nurse Sarah are having trouble communicating with 21-year-old Takaki from Japan, who is terrified and struggling to understand what's happening.
We need to do more scans.
More scan?
Yeah, later.
Oh, okay.
Right now, we're gonna roll you, okay? Is everybody ready? Yep. 1, 2, 3.
Slowly,
Little bit,
slowly.
yes, slowly. Yes, okay. You okay? Good.
For Takaki, I'm very aware that he's got an injured arm, but I need to still be able to consider that there may be other injuries going on.
Pain?
No.
Pain?
The team check for spinal injuries.
Pain?
No.
It's immensely reassuring if the spine is not tender and sensation is normal.
You just probably got a broken bone.
Broken bone?
Probably.
Maybe.
Oh my God.
Yeah.
That's okay. We can fix that. We'll get the X-ray team in.
He's frightened and he doesn't speak any English.
X-ray. Nice and still there.
Takaki's humerus or upper arm bone has been snapped clean in 2.
You can follow it up here, and then basically it stops just here where it's been fractured off, and it should be connected to this larger, round, ball-shaped piece of bone up here.
The X-ray confirms Takaki's arm is badly broken, but Dr. Martin has other concerns.
This guy has been hit at sort of 60 kilometres an hour by a car. There are reasons why, because of his language, we'll miss stuff.
Okay.
So So nothing is missed, Takaki's taken for a CT scan to look for any other injuries.
You get hot, okay, that's it. Just gonna go in and out, okay?
Too hot? Not too hot.
Not too hot, just a little hot, okay?
He's petrified. I think he's probably got a closed head injury as well, which is why things aren't computing exactly normally.
Yeah.
So there's a combination of things that are working against us.
I can see that Takaki's had a closed head injury. We're concerned that something might be going on with his brain. It may be injured, there may be bleeding inside his skull, compressing his brain.
It's a tense wait for the scans to come through.
I didn't see anything. No.
Takaki's missed a real bullet today. He's been hit at 60 kilometres an hour and all he's sustained is a fracture to his arm. We're still left with a young man who's scared and alone in a country that he's not familiar with.
Is your mum or dad in Melbourne or no?
In Japan.
Okay.
He'd ideally have his parents with him, but they're thousands of kilometres away.
Hello? Yes, the Japanese embassy. I'm a doctor calling from the Royal Melbourne Hospital and I have a Japanese national who has been injured by a car. And I was just wondering whether you might be able to have a representative come over and visit him and support him.
There's no one at the embassy available to help Dr. Martin right now.
I'm going to ring you back a bit later on.
We need to provide a bit extra support to Takaki. That's what I would want for myself back when I was younger. It's certainly what I would want for my family.
Now, I'm sorry to see you here. Can you tell me what happened?
In the emergency department, Japanese student Takaki has a badly broken left arm after being hit by a car.
I've been looking at your scans and I would recommend an operation to fix this with some plates and screws.
Orthopaedic registrar Dr. Patrick Elias has found a Japanese translator to tell Takaki he needs an operation.
これやらないとダメなんです。
With this type of injury and in someone of your age, I recommend you have the operation to help the bone heal in a better position. Would you like to proceed with the operation?
A long way from home and family, it's a big decision for the 21-year-old. Knowing Takaki will be having a stay in hospital, Dr. Martin continues his search for someone who can explain what's ahead and support him.
Hello, host mother. I'm looking after Takaki. Yes. And, well, he's scared is probably the first thing that I would say.
Dr. Martin finally tracks down the mother of the family Takaki's staying with.
Would you be in a position to come in and say hello to him and stuff?
Judy, Takaki's host mum, she understands the gravity of the situation and she's coming to the emergency department right now.
Takaki! Just relax, you're in good hospital here.
Yes. I'm so scared tomorrow.
No, you'll be all right. They'll put you to sleep.
Oh, yes.
Yeah, and you wake up and it'll all be over. Yeah.
I hope so.
Show your mum you're very brave.
Before Takaki's operation, his shoulder needs to be stabilised.
We're about to sit you up. So this will be a bit sore.
Oh, no.
Yeah, and then that will feel better after I sit you up and put a bandage on, all right? You're going to be really sore, I can see. Look, no, look at me. Look at me. Drop your shoulder down. Relax, relax, relax. Better. Much better.
Just looks miserable.
Dr. Martin has one last go communicating with Takaki before he's taken to the surgical wards, ready for his operation.
Oh, no.
Okay, do you want more medication for the pain? No.
No, okay.
Yeah, he's not buying what we're selling here today. That's all right.
So the situation today for Takaki could have been far worse. He's been struck by a motor vehicle at over 60 kilometres an hour. For many people, they will not survive that sort of injury. He'll go back home and have an impressive story to tell his mates.
23-year-old professional jockey Ethan was racing when his horse fell and rolled over him, causing life-threatening injuries.
Grossly positive pass.
Okay, so disposition's op stat.
Trying to save his life, the team pumped blood into him before he was rushed to theatre for emergency surgery to try and fix a severed vein and ruptured liver. 7 weeks later, Ethan is making great strides in his recovery.
Murphy, come on. I remember Celine being there. I was in a lot of pain, and for her to be there really comforted me. The injuries I sustained and how close I probably did come to not making it has definitely changed my outlook on life. It's made me realise how precious life actually is. It's all right, Rosie.
The emergency doctors, all the staff, they just deserve the world. Like, what they did for Ethan, I can't thank him enough. He wants a cuddle from you.
I really want to ride again. It's just going to be a matter of time before I get fit and healthy.
1, 2, 3.
Very slowly.
Don't move.
Sorry.
Back 2, 3.
There we go, okay.
French traveller Manon came into emergency with badly broken wrists after crashing her motorbike into a parked truck. To relieve her excruciating pain, Dr. Jason had to heavily sedate Manon so they could pull her wrists back into position.
You okay, Manon? You did very well.
Manon's husband, Joe, flew from Paris to be with her as soon as he got news of her crash.
Now I can move like this, so it's nice. I can move my fingers also. All the people in the emergency was cool, and I remember that. So they were super kind.
Surgeons fixed her wrists with metal plates, and after a final checkup, Manon was given the all clear.
Is everybody ready?
Yep.
1, 2, 3. Little bit. Yes, slowly. Yes.
Japanese student Takaki was brought in with a badly broken arm after being hit by a car as he crossed a busy street.
You just got a broken bone.
Broken bone?
We can fix that.
The team had to find a way around the language barrier to help a scared Takaki understand what was happening.
Can you see?
Yes, okay.
The next day, Takaki had a successful surgery to fix his broken arm and was able to go home with his host family to recuperate. 9 weeks pregnant Caitlin badly fractured her leg and wrist after a high-speed car accident. Doctors feared the 24-year-old may lose her baby.
So there's blood everywhere?
As Caitlin was taken to surgery to fix her broken bones, there was no guarantee her baby would survive. Caitlin had an operation to put a pin in her leg and set her broken arm.
It actually looks better than what it did before.
Now, 6 weeks later, she's back home being cared for by her mum and fiancé Riley, happily looking forward to the birth of their baby.
Thankfully, at my 13-week scan, baby was more than okay. Would not even tell we were in an accident, which was very great to hear. I think it could have been so much worse. I think we're both extremely lucky to be alive.
So we have a helicopter arriving with a seriously injured motorbike rider.
Air ambulance is touching down with the badly injured man from country Victoria. The 61-year-old motorbike rider is being rushed in after colliding with a vehicle.
What's his name?
Hi, Bear. I'm Sarah.
Hello. Emergency nurse Sarah Thomas has assisted on hundreds of motorbike accidents and seen and heard it all.
I did not say that.
You did, and it's okay.
No, I didn't.
All right, everyone ready? Ready, set, go.
All right, I'm just going to pop a bunch of monitoring on you, okay?
Yeah, no worries.
Yeah.
Everyone happy for a handover?
61-year-old gentleman riding a motorbike downhill. He was sideswiped right side by an oncoming vehicle, which has knocked him off his bike, and he's slid about 20 or 30 metres. Impact looks right side. He's got tip fib, which is open with evident deformity.
How's that leg?
Really bad.
Really bad.
Oh, yeah. Around the 9, 10, and I'm shooting up towards 14. Oh, but it's like hell.
Tow truck driver Bear's leg was smashed when the full weight of his bike fell on him.
Were you able to get up and walk from the scene at all?
No. I had to crawl off the road.
He's in a lot of pain. He's got significant injuries from the accident that he's been in. So just trying to figure out exactly what those injuries are.
Okay, looking at elbow.
Bear has a serious open fracture, which means his broken bone has pierced through his skin.
X-ray.
More hands are needed. Emergency doctor George Plunkett gets up to speed.
He's 61 years old, motorbike rider.
His numbers good?
His numbers are all good. He's just a 10 out of 10 pain on his leg.
Well, the obvious injury Bear's got is a broken shin bone and the little bone next to it. And those bones have unfortunately come out and poked through the skin. Patrick, George, how you going? I've got somebody with an open fib down here. So this is a motorcycle versus car. Open fractures are really prone to getting infections in them. There you go. Oh, I'm George, I'm one of the emergency doctors. How are you getting on?
Like.
Yeah, I know. Made a bit of a mess of that leg, yeah?
Yeah.
So it's broken, that needs surgery. Wounds like this that are left without appropriate management are really high risk of getting really nasty infections into the bone and lead the bone to not really heal at all. So then you've got a leg that doesn't really function. Then we need to wash that wound out and put you in a plaster. This is possibly a life-altering injury for Bear. You might not be able to do those activities that somebody might think are normal and key to their life.
Maybe about half an hour to get back. Just been called by the ambulance to say they're bringing someone who's been critically injured. It's turning into a manic Monday. So, gentlemen.
Gentlemen? Gentlemen usually means I need your help ASAP.
Sharing the load. So they've just called through another trauma. It's a man who had a concrete slab, they think about 300 kilos at a worksite, fall onto his upper body.
Emergency doctor Glenn Harrison takes the case.
Let's get ready.
Just received a call, 29-year-old male who's got a severe head injury. He may well have skull and facial fractures, amongst spinal fractures as well. And that the risk is that he has severe bleeding on the brain.
Paramedics arrive with critically injured stonemason Michael. In excruciating pain and losing consciousness, they sedated him and put in a breathing tube so he would survive the trip to emergency.
He is on a ventilator. Raises suspicions for us that he does actually have a severe brain injury, and so it becomes a
potentially life-threatening injury. Tim, we're going to have to flatten him down to get him across.
I'm just worried that he might have severe complications, including seizures and increased swelling on the brain.
Can you just have a look at his pupils? Just tell me what they're doing.
Equals to?
The pupils are symmetrical and equal at the moment. The warning would be if there's abnormal pupils size on one side, that is a big warning sign for us. And he would need to have urgent neurosurgery.
We're ready on 3, 1, 2, 3.
Good. Guys, happy to start your primary? Do the handover here? Yeah, that's great.
All right, everyone, this is Michael, found by his colleagues out in regional Victoria today at 10 a.m, receiving an isolated head strike with a 300-kilo cement sheet. He's got obvious head injury. The ALS guys have arrived on scene to find him agitated, combative, and unable to facilitate assessment. The injuries that we've been able to ascertain is a mix between penetrating and blunt force to the superior region of his skull.
Can I clarify his injury?
Yep.
The slab hit him from where? The front or the back? Or?
It appears right on top of his skull here.
Right.
He's also got a slight gash to his right eye as well. Okay. I've got photos of the mechanism I can show you.
All right, good.
Michael was crushed when the cement slab he was installing fell onto him.
Looking at the photos, that's a significant weight that's fallen on his head, and that raises real high risks for this patient.
Okay. Primary survey, please.
Okay, so intubated, trachea's midline. You've got equal air entry to bilateral tummy softened on the head down. 2 mils and quite sluggish.
Yep.
His head injury could be life-changing, but he may also have critical internal injuries, putting his life in immediate danger.
What images have you done so far, sorry?
I've done both sides of the abdomen as occlusive repeated.
Okay, so no free fluid, no pneumothorax, just an cardiac to finish off. Okay, we'll get our x-rays. Chest and pelvis, please. Yeah, thank you. Has everyone got lead on?
Yeah.
That's okay. It's pelvis more than anything else. Thank you.
That's the best you're going to get, but you can clear it.
X-rays of the pelvis are unclear. CT will show the extent of Michael's injuries.
Need some suction in here.
We're not sure where the blood is coming from. It could be that he's bleeding internally. So we need to get him to CT as soon as possible to find out where this bleeding's coming from.
I just suctioned a whole heap of blood out of the mouth.
Nurse Liz has identified he's bleeding from his mouth. Uncontrolled bleeding is dangerous in a trauma patient, and so we need to stabilise him and get him to CT as soon as possible.
Oh, hi, it's Michelle from Royal Melbourne.
Michael may not make it. Dr. Michelle calls his wife, who's on her way.
All right.
Let's package for CT.
I told CT they're ready.
Dr. Glenn gets everyone moving. They can't wait a moment longer. Michael's life is in danger.
3, 1, 2, 3.
The risks of taking Michael around to CT out of the emergency department for a patient that's unstable, that runs the risk of a patient becoming even more unstable.
Right, now's the waiting game.
Worst case scenario now for Michael is that he's got significant swelling and pressure within his brain that requires going to theatre urgently.
He's got traumatic frontal blood with probably a contusion. He's got some facial fractures, same side.
So looking at Michael's scans, he's got significant injuries to the bones of his face and the frontal bones of his forehead. He's also got bleeding on the brain and bruising of the brain. And so there's significant injuries. I'm worried those injuries will get worse with more bleeding and more pressure in the next couple of hours. We need to make sure we're looking after his pulse and his blood pressure. All those things will help prevent secondary brain injury.
Okay, we're getting you some pain relief now.
Dr. George is looking after 61-year-old tow truck driver Bear, who may lose the use of his leg after it was badly smashed when he came off his motorbike.
I've had a chat to my orthopaedics team.
Yep.
They're on their way down to help us out with this. We also need to do some CTs. You know, you've got a pretty distracting injury there, so we want to make sure that you're not so distracted by the bone sticking out that you're missing other bits and pieces.
I'm giving you pain relief through your drip now, okay?
All right.
Rightio, I'll get things organised and we'll get this fixed up for you.
No worries, thanks very much.
Because we can't necessarily tell what injuries he's got that aren't so obvious, he needs CT scans of his brain, of his neck, and all the way down through all of his abdominal organs and his pelvis.
You allowed to make a phone call on my behalf?
Yeah. Who you want me to call?
My sister.
My sister?
Bear lives hundreds of kilometres from the Royal Melbourne and has no one who can be with him.
What's happened?
Why don't you talk to dear sweet?
Sarah. Hi, my name's Sarah. I'm a nurse at the Royal Melbourne Hospital. How are you?
I'm devastated. He's such an important part of my life. The bike, that lifestyle, riding a motorcycle was something that he loved to do and it made him enjoy his life.
When the accident happened, Bear was on his brand new bike, getting ready for a very special ride.
I bought that bike because my youngest son died 7 years ago.
Oh, I'm sorry to hear that. That's horrible.
It's, I'm supposed to be, I've organised a memorial run for him.
Yeah.
That bike was supposed to carry me and a small memory urn.
Yeah.
Yeah, we're supposed to be going over to Western Australia to Wave Rock.
Oh, God.
Yeah. And then this.
Okay. This is just to prepare you for the sedation that we're going to give you to pop your leg back in a normal spot. Have you got the drugs drawn up, George?
I do.
You do?
I'm Patrick, one of the orthopaedic doctors here. What we're going to do now is get that cleaned up with a plaster on, get you over to the scanner.
Bear's shattered lower leg will be pulled back into place before plastering.
So in a tick, I'm going to give you some medication, drip you up to sleep, yeah?
Yep.
I'll give it to you kind of one beer at a time rather than making you shotgun the six-pack. That way we get you asleep well, but for the shortest period of time and with the fewest complications. So don't be surprised that you're not going to be straight out like a light, okay?
No.
What we're wanting to do with sedation is provide enough anaesthetic that he's pain-free, that he can't recall what happened, and that he has a pleasant experience.
It's going in now. You'll probably start feeling a little bit sleepy soon, okay? Try and keep your eyes open for us. It's just essentially like a couple of beers.
I don't drink.
Oh, well, you smoke and you ride bikes, but you don't drink.
Yes, and I've also been to war and all the rest, but
You've been to war. Okay. Which war did you go to?
Somalia, Afghanistan, Iraq.
What unit?
Hello.
Yeah, he doesn't drink, so he's got like
Only go a little.
no tolerance.
Only go, yeah, so 40-40.
40 and 40.
Yep. It's good to go, Patrick.
Nice deep breaths.
As they begin the procedure, there's something wrong. Bear is not breathing.
People aren't breathing, they're not getting air in, they're not getting oxygen in, their oxygen levels can fall. Then we have to take further steps, more aggressive steps, to make sure we take over his breathing for him. We make sure that, first off, we don't panic, that things aren't catastrophically getting out of control, and if we think the airway is obstructed, is to pop a piece of plastic tubing in the mouth that goes into the back of the throat and holds the tongue forward, to try and keep airways open. Decided to put his stents back up. You said you've got this on?
Yep, fine.
Cool.
They keep pumping air into him as Dr. Patrick works quickly to get the plaster on.
There you go now.
He's breathing.
Yep. So I'm getting a couple more breaths in and I'll swap back over. Okay, I'll swap back over. He's good now.
Do you have a motorbike?
Do I have a motorbike?
Yeah.
Do you think I've got a motorbike?
No.
Right.
You never know, though. I never thought you'd played in an orchestra either, but you do. You're okay, mate.
Oh, thanks for helping. Greatly appreciated.
That's all right.
Time to wake up, my friend. All done. Oh, hello.
It's
you
all
might
done.
be one of the best patients I've had. You do everything I say. All finished.
See you, mate.
You're awesome.
I'll take that. If he had not had the support that he received, he may very well have not started breathing for too long, which can be really dangerous.
Suddenly, he's in trouble again.
Bear, bear, bear.
All right, we're back.
29-year-old stonemason Michael has just been scanned for potentially life-changing injuries after being crushed by a 300-kilogram block of concrete.
Just wondered whether you just moved.
To keep Michael safe while they wait for the CT results, it's vital he stays fully sedated.
Yes, he's moving. I might just bump this infusion up.
But he's waking up.
Yeah, he's not liking that. Yeah, I was going to bolus him.
Michael, you're in hospital. It's okay.
It's important we keep Michael stable and sedated on the ventilator.
I've just bolused him 50 of probes and I put him up to 120 an hour.
We're on the risk of him pulling out his intubation lines and his IV lines, and so that's a real risk for him.
Yeah, much better.
All right, we're winning.
Cool, well done. Good troubleshooting, team.
With Michael now stable, his wife Tegan can be with him.
It's no doubt the worst day of my life. We've been together 13 years. He's my best friend.
For Tegan, it's an agonising wait to see if her husband will ever be the same.
We have a 3-year-old daughter, Minnie. And he's a really good dad. She's everything to him.
Dr. Glenn can now see the full extent of Michael's shocking injuries.
There's certainly extensive fractures through his face that'll probably need to have something done from the plastic surgeons. We can see here that there's bleeding in the frontal lobes here on the right-hand side of the brain, and we can see that there's probably a little bit more blood underlying that area between the skull and the actual brain tissue. The big thing that we do see here, that bruising on the brain.
There's lots of different ways this may manifest. So Michael may have some difficulties communicating and there may be seizures. So what's next for Michael is really a period of time in the intensive care unit. So Michael's brain injury is potentially serious and time will tell with further testing, but Michael's not out of the woods just yet.
Three babies to get a cake on your...
I know, I was just saying that. I've had 3. I even had 2 at once and nobody bought me a cake. I feel like this is a good moment.
When we came back, we didn't get a cake. No, I didn't get a cake.
Maybe we can make this everyone's cake.
Everyone's cake.
Senior emergency doctors Emma West and Maya Kubert are celebrating Dr. Jana Alexander's return from maternity leave.
This is delicious.
Beautiful to Cheers to you.
Thanks, guys. And so now we can end the debate about what's easier, being at work or being at home with 3 kids. Being at home with 3 kids is much harder.
Yeah, there's no debate about that. Yep, all right, cool. Thanks for your help, Andrew. Bye.
It's not long before Dr. Maya's back on the ED floor. Her next patient, 74-year-old Jerry, has arrived with severe chest pains.
In our usual workup of chest pain, we get a chest x-ray. And Jerry's chest x-ray is very concerning. There's a shadow around what we call the aorta, or big vessel in his chest.
So what kind of pain was it? Did it wake you up from sleep?
Oh, yeah, it woke me up.
So have you ever been told you've got any issues with your heart?
No.
Now, I would normally use a CT scan with iodine-based contrast. I can't do that for Jerry because he has anaphylaxis to contrast dye.
Have you ever had rheumatic fever as a child?
No.
No.
Been disgracefully healthy most of my life.
One of the ways we can look at the aorta is using an ultrasound machine. Jana is much better at ultrasound and echocardiography than I am, so I've asked her to have a look.
Dr. Myers asked me to look for a small tear in your big artery coming out of your heart. We are trained to look for the scary, life-threatening things. I'm just going to get you to pop your head back for me, and I'm just going to have a little look up here.
Jerry's son, Chris, rushed to his side as soon as he heard his father was in trouble.
Thanks for coming in, Chris.
I was a bit shocked that there could be something this wrong with his heart. We both ran marathons, so he's been a great role model for me, Dad. So it's hard. It's difficult to see him unwell.
Has anyone ever told you you've had a narrowing of one of your valves?
No.
No.
Is that what's happened?
Well, look, we can't exclude it on this ultrasound. But we need to have a chat to the specialist and figure out how we're going to investigate you further, okay?
That would be an appointment at a later date.
No. You're not going anywhere until we figure it out.
Right, okay.
Okay, so not an outpatient thing. This is a today thing. I'll have a chat with Maya. She's your doctor officially, so I'll just go let her know what I saw and then all the best. And she'll give me out, no probs.
Dr. Jana's ultrasound has revealed a potentially fatal problem.
So he's got aortic stenosis.
Yeah.
And looks like calcification around the valve.
So when Jana had a look, Jerry has a big bulging area where the wall of his aorta has become thin and has popped out. That's a big vessel. It delivers the blood to the rest of the body. If it were to rupture, he would be at significant risk of death.
Bear. Just take a breath, mate. Nice deep breath for me. You okay?
In emergency, Nurse Sarah is looking after 61-year-old Bear, who stopped breathing twice.
Do you have sleep apnea? Do you stop breathing in your sleep?
No.
No? You did a little bit there, just a little bit.
I did.
So I might actually just pop some oxygen on you because your sats are dropping.
Some people stop breathing when they're snoring. Some people stop breathing with the anaesthetic.
Don't lift your head up.
Oh,
we need to make sure we keep him safe, but that's why we keep so much monitoring on these patients.
We're going to go to CT.
A trauma patient like this will be managed as though they've had a spinal injury until we've proven they don't.
All right, Bear. We're just going to roll you and move you onto the CT table, okay?
Somebody in Bear's case will be imaged entirely through their spine to look for any fractures.
Don't stop breathing. Just remember to take some deep breaths, all right? 1, 2, 3. So we're hoping for Bear that we don't see any internal bleeding or internal injuries. I'm hoping that it's just localised to his leg, that there's nothing else going on.
Will I get a coffee today?
No. I think Bear's probably feeling alone, which is really sad. Maybe a little bit disappointed that he wasn't able to do what he set out to do on his ride. Considering the meaning of it, it's quite significant.
Back in my little room.
Back in your little big room. I will go and find something to put on your lips if I can, okay?
I know I should, but...
You just give me a minute, Bear. I'll be right back. It's all about the small things. He has very dry lips. It's incredibly important for people to feel heard. As human beings, all we want is for somebody to hear us and to understand and to empathise. It's a really important aspect of our job. All right, this stuff is peppermint lip balm. Better than nothing, yeah?
And I can't have water or anything.
Open, like, yep.
No, I've never worn a lippy.
I can't live without mine. My lip balm, not the lipstick, obviously. All right, is that better? A little bit?
Yeah.
Yeah. You're allowed this much. Don't tell anybody. Swirl it around. Open a bit more.
Angel.
I'll settle for Angel.
Bear's results are finally in.
This is his leg. Yeah, so it's all just totally shattered. Should be one single straight bone, instead broken. You know, an injury like this is going to mean multiple operations, time in rehabilitation, prolonged recovery time, and the question remains to be seen how fully Bear will recover from this. Will he get totally back to where he is, or will he still be left with some deficits?
Bear may never be able to do the memorial ride for his son.
So for Bear next, he gets admitted under the trauma unit, and then his care will transfer over to the orthopaedics team because he needs surgery for this leg within the next 24 hours. It's just going to be in the lap of the gods as to how well he recovers.
"74-year-old Jerry needs urgent CT scans after arriving in emergency with severe chest pain.
Oh, hi there, it's Maya here in ED. Could you put me through to a cardiothoracic reg on call, please?
Jerry's X-ray and ultrasound have revealed a life-threatening problem. Dr. Maya alerts the cardiothoracic team.
See whether you might have capacity to look at the CT and the chest X-ray and help me decide whether that's required.
So for me, my job is to make a diagnosis. And my other job, while doing that, is to get all the people around Jerry that he will need to keep him safe while we get on and fix the problem.
I don't like the look of the scan. Hi, it's Maya again. I just wondered if you'd had a chance to pull up scans. They're very abnormal. He's got a very large aortic aneurysm on the root of his aorta. The radiology consultant is having a look at it at the moment, but they are concerned, I'm concerned.
Aortic pathologies are life-threatening diseases. They're like walking around with a time bomb in your chest. They can rupture at any moment and they will cause you to die. He's going to need urgent surgery.
All right, I'm gonna go and tell him. You just shuffle a bit. There you go. Can you see that?
Yep.
That white bit there is normal, that's your heart. But see that bit there?
Yep.
That's not normal. So then on the scan, if we look in here, this is us going from the head down towards your feet. And that's the sac. So this is the pipe that's an arch.
Yes.
And that's the sac that shouldn't really be there.
Yes.
That's not okay. That sac is not a new problem. That didn't come today.
Right.
But that bit further down with the calcium, and that could be the cause of your pain. It could be that something's displaced a bit.
But the pain is
still there, yes.
Yeah. But it's sort of a dull ache now.
Yep.
Yeah.
Potentially, like it could burst.
Yeah, that's the worry. There's a problem, it needs fixing, and yeah, we need to do that today.
Right.
And it's right to be a little bit frightened, I think. That's okay.
Yeah, that's not used to being...
No, you go from no doctors to too many.
I had no thought that my dad would have an issue like this. I thought of all the things he could have, but I was just in disbelief.
what next. So they're looking at your scans now, and that's what will happen next. In the meantime, I'm going to move you to just a slightly more visible part of the department.
Thank you.
If you were to eyeball him from the end of the street, you'd say he looks fine. There's nothing wrong with that guy. But his underlying diagnosis is of a life-threatening condition.
How are you, Kerry?
During a busy shift in emergency, Dr. Emma takes a break for a specially prepared treat.
It's actually pretty good.
The chef is Dr. Emma's 14-year-old daughter.
This is the first time Maggie's actually made me dinner, and it's really good, so I'll be ordering from her all the time.
Dr. Emma's meal is cut short. A young woman just weeks away from having a baby has arrived in acute pain.
And where's your pain? And when did it start?
5 days ago.
Okay.
Yeah.
20-year-old Ellie and her partner Fraser were told to come into the emergency department by their GP.
So you're 32 weeks pregnant, first baby, but this must make you feel a little bit nervous.
Yeah, it's just, I don't want to deal with the pain.
Yes, okay.
Struggles to sleep.
Yeah.
Okay. Ellie actually appears relatively relaxed. She just wants to know what the cause of her pain is. She appears fresh. She just, really wants to get to the bottom of the problem. But she's presented with chest pain, and chest pain in pregnancy is a really worrying problem. Have you had any fevers? Faint or dizzy?
Sometimes dizzy.
Okay, and is that normal or?
I think that's normal.
Yeah, okay.
Yeah.
And then have you had any calf pain?
Yeah, on the right.
Okay.
Yeah.
And when did you notice that?
Like a week ago.
Pregnancy puts you at risk of a number of quite serious medical conditions. One of them, probably the worst one, is something called a pulmonary embolism, a clot travelling from your leg up into your lungs and causing chest pain. At worst is a life-threatening condition, and combining that with pregnancy, it puts both the baby at risk and also the mother. I want to just have a little feel of your tummy. So that's sore.
Yeah.
Yes, sorry about that.
It's okay.
You feeling baby move today?
A little, yeah.
Yeah. Do you have any family history of clots on the lung? That's all?
Yeah.
Yeah. And that side's not sore. Okay, no worries. Not sure if it's actually something in your tummy, like a gallstone, or it even could be something in your chest.
Yeah.
There's a condition where you can get a clot from your leg that goes to your lung. Yeah, that's one of the concerns. I'll come back shortly.
With both lives in danger, Dr. Emma wastes no time getting Ellie x-rayed. The source of her pain must be found immediately. Dr. Emma also needs her to have an urgent ultrasound.
I do need a diagnosis tonight.
With radiology busier than normal, Dr. Emma calls on emergency Dr. Luke Delarue, an ultrasound specialist.
But can you tell me that she's got no big gallstones? I know it's not.
Yeah, I can see
I know
if
it's not definitely.
Yeah, I can see if there's obvious gallstones.
Yeah, but if they're obvious, that's sort of.
Yeah.
Working in emergency, you work with people who have different interests, special skills, and it's really drawing on each other's strengths and making sure that you do the best for the patient. And so I'm lucky to have Luke around.
So I'm just going to have a look at a couple of things, and the main one is your gallbladder. It can be a bit tricky. The gallbladder is this kind of round, oval-like shape. It's a bit tricky. Is that sore if I push like that?
Yeah.
All right, I'm just going to try one more little view around the front.
She's also very tender over the right-hand side of her tummy. We're searching for other causes of her pain.
To be honest, the main difficulty is going to be that you've got a human pushing up your diaphragm.
Yeah. Because it'd be nice to find something that's not as life-threatening as a pulmonary embolism.
So I can't see any stones, which is what we're looking for. It's a limited exam, though, because you've got Bub in the way.
Yeah.
When was your last fetal heart rate done?
I had one today, so it was my last checkup last week.
Okay, let's just have a good look, eh?
As long as her heart's good, isn't it?
Yeah, fetal heart's within normal range, definitely. It's good. I'm just doing a quick scan of her leg, so I've got to go up into the groin. Is there anything?
So this is where Ellie is sore, just in this area. and it's actually nice and clear. Can't see any cause for her pain. I can't see pneumonia.
Hey, it's Luke.
Yes.
I can't get great views. All I can tell you is that at the level of, like, the inguinal canal...
There's nothing?
There's nothing, yeah.
So we really don't know what the cause of the pain is, and we don't know that there's gallstones, and it really still could be a pulmonary embolism.
With no definitive results, Ellie and her baby could be in trouble.
Part of the reason I'd like to do this scan called a CT pulmonary angiogram is it's a little bit unclear to me if it's your chest or your tummy.
Yeah.
And even if the ultrasound was normal, I would still like to go on and do a further study because I think there's possibly something wrong. If there is something wrong, I want to know about it.
He came in with some chest pain that woke him from sleep this morning at 4 a.m.
Scans revealed that 74-year-old retired schoolteacher Jerry has a potentially fatal aortic aneurysm.
Resus 5, yep.
Surgeons need to operate immediately to save his life.
Thank you, bye.
So this is extremely confronting for Jerry. He woke up this morning with a bit of pain in his chest, and I've told him he might die. You can imagine it's not the way he thought his day was going to go.
I'm horrified that I have to have chest surgery, you know, open heart, you know, that. But I guess it is what it is, and you do what you can to survive. I mean, if I don't have it, from what I can gather, you know, it's pretty bad. Might not have that long if I don't.
Dr. Meyer mobilises all the cardiac specialists it will take to try and save Jerry's life.
He has a life-threatening condition, and we are not often given an opportunity to fix these problems before they kill people.
Hello.
Hello, how are you?
Good, thanks for coming down. Steph's been in as well. So currently involved is the cardiothoracic team, the vascular team, both of whom have been at the bedside, and also now a senior cardiac anaesthetist and a senior cardiac radiologist. The current thought is probably for an MRI to further delineate the branches of the arch of the aorta in terms of a potential plan for an elephant trunk procedure.
So this will be extremely complex surgery. He'll need a very big team of surgeons, and they'll need to be very experienced vascular and cardiac surgeons to try and fix the problem without him dying on the table.
I'm going to follow up in the next few days and find out what happened to you.
Thanks, Maya.
Lovely to meet you, and I'm extremely glad that you came today.
Yes.
Yes, definitely. Thank you so much.
See you.
20-year-old pregnant Ellie could have a life-threatening blood clot after being rushed to ED in severe pain.
It's very clear to me that we need to find out what's wrong. I think the safest thing for you tonight is to have the CT scan, because part of my worry is you've had some calf pain and chest pain. I don't know what to make of your tummy pain, but the top of your tummy will be scanned. I want to investigate Ellie for a pulmonary embolism, but it does involve a scan and radiation exposure. So I really need to be able to communicate to her the risk of the diagnosis not being made versus the risk of the radiation exposure. So there's radiation exposure to your baby, but at a very safe level. Any theoretical risk is very low. And if you put it against a risk of not finding a diagnosis that could be harmful to you or your baby, what questions does it bring up for you?
Not really any. I think
Okay.
I explained it very well.
Okay.
Sounds like, yeah, I mean, that's a necessary risk. I think,
Yeah,
to find out what
that's right. Yeah, yeah.
Hello, my name's Dan, one of the radiographers. We do a scan for your chest tonight. Okay.
If there's a clot there, there'll be a blockage, and it'll be immediately apparent that she's got a pulmonary embolism. On first inspection, I can't see a clot. No evidence of acute pulmonary. So you don't have a pulmonary embolism?
Oh, good.
And there's nothing abnormal I can find in your lungs?
Good.
Just looked at your heart tracing, and it's just not quite right, so I don't know what that means. So I'd like to know a little bit more about that. Regardless, I think I'm going to keep you in hospital overnight to get a formal ultrasound in the morning, because your tummy's a little bit sore there too, and we want to try and fix that. Ellie's clearly got pain. It's unexplained. Any illness in pregnancy is high risk because you're really dealing with two lives. The safest thing for Ellie now is for her to be admitted to hospital. She'll have an ultrasound in the morning. She'll see a cardiologist in the morning. And I'm really hopeful that everything will be okay.
All right, everyone ready? Ready, set, go.
All right, I'm just going to pop a bunch of monitoring on you, okay?
61-year-old motorbike rider Bear badly fractured his leg after colliding with a car.
Made a bit of a mess of that leg. Yeah. So it's broken, that needs surgery.
Bear was planning a memorial ride for his son, who passed away 7 years ago.
That bike was supposed to carry me and a small memory urn.
Yeah.
Yeah, we were supposed to be going over to Western Australia to Wave Rock.
5 days later, he's recovering after surgeons reconstructed his leg with plates and pins.
But I've come through it pretty lucky.
He has a long road ahead, but Bear's got unfinished business.
Hell or high water ain't going to stop me from getting on that bike again.
Jerry came into the emergency department with chest pain, thinking he'd be discharged and sent home the same day.
It looks like a very abnormal aortic scan.
Aortic pathologies are life-threatening diseases. They're like walking around with a time bomb in your chest, and they will cause you to die.
He needed life-saving surgery that lasted more than 8 hours. After a second mammoth surgery, Jerry is now back at home recovering.
They found another aneurysm further down in the below the heart. When they opened me up, the surgeon put his hands in to gently pull the aneurysm towards him, and it burst. The nurses and doctors at Royal Melbourne were outstanding. It's the only word to describe them. Thank you, all of you. I felt pretty lucky having them aneurysms out. I suppose it's maybe I should buy a lottery ticket.
Cheers to your health.
Cheers, mate. You too. Thank you.
Ellie, yeah. And where's your pain?
20-year-old pregnant Ellie arrived into emergency with severe abdominal and leg pain.
So that's sore?
Yeah.
That's all?
Yeah.
Dr. Emma worried Ellie's and her baby's lives were in danger.
Pregnancy puts you at risk of a number of quite serious medical conditions. One of them, probably the worst one, is something called a pulmonary embolism.
Even though the CT scan was clear, Ellie needed further investigation.
Regardless, I think I'm going to keep you in hospital overnight.
Thankfully, a beautiful, healthy little girl was born 8 weeks later, and all Ellie's tests were clear. Baby Adeline is thriving, receiving lots of loving care from her mum, Ellie. Stonemason Michael's head was crushed when a 300-kilo concrete slab fell on him.
Right, now's the waiting game.
Scans revealed he had multiple fractures to his face.
We can see here that there's bleeding in the frontal lobes here.
And so they're significant injuries.
Doctors were concerned Michael would have life-altering disabilities. After only 12 days in hospital and surgery to fix his facial fractures, Michael's home with his family.
Conversation I had with the doctor, he explained the scenario. I said to him straight, how am I alive? Because I knew the weight of the stone. And the doctor said to me, you're a very lucky man. And yeah, so my main fear was what would be the future from those injuries. When I can go back to work, I'm definitely going to be working a lot less. I think an incident like this is what I needed to actually change my priorities in terms of work and life balance. And yeah, definitely want to spend more time with my wife and daughter.
She tipped the whole bubble container on what she was wearing.
For Kinder. That doesn't surprise me. Does she want me to come and pick her up today?
Yeah.
Well, the treatment I received in hospital was amazing because they definitely saved my life. And yeah, that's pretty much all there is to say about it, really.
Royal Melbourne receiving, go ahead.
Good afternoon, Royal Melbourne. We've got a 35-year-old male truck driver who's got an incomplete amputation of his left leg.
Director of Emergency, Dr. Mark Putland, is in charge of the flow of patients today.
I'm just checking how far away you are from here. What's your ETA?
Yeah, traffic's pretty heavy, 25 to 30 minutes.
So we have a young man who's crashed his truck. There's serious injuries to his lower limbs. We're clearly going to have a very confronting scene when he arrives. There'll be a lot of pain, but there'll be a lot of fear as well.
Preparing for life-threatening injuries, Deputy Director of Emergency, Dr. Nicola Walsham, rounds up the troops.
Oh, trauma. All right, so we'll gather our team and then we'll do our briefing.
2 tourniquets ready to go. We've got a line train ready to go, yep.
Yeah. There are people who arrive at hospital with really a few minutes to live or die, depending on what we do.
All right, shall we check together?
Yep.
Okay, we've got an O positive.
We want reasonably large number of things done very quickly, and then in the first 5 to 10 minutes.
Terrific.
The critically injured tow truck driver has just survived a terrifying ordeal. The 39-year-old is in excruciating pain, with his leg almost sliced off.
Hello. Hello.
I'm James.
Any immediate life threats?
That's the cabin. It's gone through his legs there.
It's eye-watering?
Yeah.
He's had a really prolonged period of entrapment in the truck because of the machinery being crushed around him. The injuries to his leg are clearly horrific.
Hello, you from anaesthetics? Yeah, wonderful. If you can take over, that'd be great.
Okay, so let's make this nice and smooth.
He's clearly extremely distressed. The good thing that we're seeing is that he's awake and he's screaming in pain. Now, that's a terrible sounding thing to say, but it means that we know his brain is intact.
This is Heath, lives at home with his wife, independent with ADLs, no past medical history, no allergies.
Heath's partner, Nicole, is rushing in to be with him.
You're okay, mate. We're going to look after you, okay? I know you're in pain. Lots of people around you. It's okay. Everyone's here to look after you, okay? I know.
On our arrival, complaining of extreme pain, he actually tried to physically hop out of the truck while he was still trapped.
Oh, legs are
We're just trying to
I can't feel my legs.
Heath, I know you're frightened, mate, okay? You need to let us help you, okay?
Open your eyes, mate. Squeeze my fingers. Squeeze my fingers.
Before they can even take a look at Heath's mangled legs, they need to get his pain under control.
You need some stronger painkillers.
Yes.
Heath is extremely agitated. He's in a lot of pain. He's frightened. We just need to calm him down and gain some control over the situation. Listen, you need to stop moving.
Narrow shoal outside large Croatian port.
Emergency doctor Andrew Trezise is a problem solver.
Well, it is a cryptic one. I do like doing the crossword. Begins with an L. Can be a very challenging job, so to do something that's completely different is quite a nice little break. It's quite a satisfying thing when you get it right. Not that I get it right very often.
It's a store.
Thank you.
Dr. Andrew's break is cut short by news of a critically injured patient coming in by air ambulance from country Victoria.
G'day Royal Melbourne, we've got a cyclist that's been involved in an accident with a motor vehicle.
He's been struck by a moving van. My biggest concerns are going to be, is there a significant head injury? Broken ribs, punctured lungs, they're all basically life-threatening injuries that you can get from an impact like this. Neck injuries can actually be lethal.
You can always jump on airway if we need to.
Yeah,
but, hopefully we won't need to.
Dr. Andrew is gathering his team as the chopper arrives, bringing in 53-year-old cyclist John.
Just a few bumps, mate.
The retail worker was riding home from work when he collided with a van.
It's a bumpy old helipad, okay? Whereabouts were you from the hospital? Were you near the hospital? I work at Bunnings. Oh, do you? Okay, yeah.
So have you done a brief for the team?
We did a quick brief.
He's here.
Oh, he's here.
Good afternoon, sir.
Andrew's team leader.
Hello, hi. Toby, hi.
Our patient is John.
John, hi, John.
Assisting Dr. Andrew is emergency doctor Emma West.
Do you want X-ray to do a chest X-ray?
I think I would do chest and pelvis,
Yeah.
in this guy.
I always enjoy working with Emma. Emma's extremely experienced. Having somebody there who's able to step in just in case everything gets a little bit out of control is quite reassuring.
On the count of 3, all the way. 1, 2, 3. Well done, mate. Right, we're just gonna. Is it okay if we cut your top off, mate, just so we can assess you?
Yeah. Can you open up your mouth for me? Any pain on the chest wall as I'm pressing there?
So this is John. He was riding his push bike today in Warragul in Gippsland. Yep. Wearing a helmet.
I'm just going to pop another needle in so we can do some blood tests.
Head wearing the helmet has struck the windscreen and caused an enormous indent in the windscreen, so pushing it in with a large spiderweb pattern. He's actually pretty lucky considering. So injuries, I think, would probably be neck, possible right-sided rib.
Is your shoulder sore?
Yeah, well, not the shoulder, what you call it, these...
Collarbones?
Yeah.
Yeah, OK.
Deep breath in real fast, my friends. Good.
The team quickly scan for anything that could be immediately life-threatening.
Deep breath in again. Good.
The ultrasound doesn't show a significant injury, which is great. There's no bleeding internally, and we can't detect a pneumothorax.
The damage to John's bike helmet reveals how hard his head hit the van.
So it's done its job.
Yeah.
But it's going a bit now.
Yeah, definitely.
What's hurting at the moment for you?
Sort of neck and just shoulders are just sort of...
Both shoulders? Yeah, stiff on the neck.
The neck pain is worrying. Neck injuries can be life-threatening. We need to find out what's going on pretty quick.
We'll just start off with some fentanyl boluses, maybe 25 of fentanyl.
John lives more than 100 kilometres from the hospital, so his son can't be with him.
Can you tell me what happened?
Yeah, I was just heading from the cycle track, crossing the road to get on the other side cycle track. And
How are you going over there?
yeah, just a car. Just trying to get between cars.
The other side.
Just mistimed it and then I hit the van.
John's able to interact with me, so it says that his brain is computing well, and that's a good sign for him. But we also know he's hit that windscreen at very high speed, so the risks aren't all gone.
But it sounds like primary, no acute concerns at the moment, and nothing particularly on the secondary, really, except maybe some chest wall tenderness. And observation's all stable, so we'll get the bloods off, and then we should get a portable chest and pelvis.
I'm just going to hold your head nice and straight.
To protect his neck, the team quickly get him into a hard collar.
Slightly less comfortable, I'll say, but better just until we know that you don't have any injuries. Is this wrist sore at all? So we're just here to do some x-rays, okay? X-ray.
So at this point with John, we've done the basic stuff. We've done the ultrasounds and the x-rays, and at the moment we're happy he's stable.
So you stay nice and still like a board. And we're ready to roll on 3. 1, 2, 3.
All right, mate. Any pain? Yes or no?
Yeah, my neck.
Neck.
Just in the neck? Yep. Pain where I'm pressing there?
No.
Any pain here?
From his neck downwards, seems all right. But the fact that he's actually in quite a lot of pain is worrying me a lot.
So we're going to get those scans done shortly. So we're going to scan from your head down to your pelvis, see if we can find any injuries. We've definitely sort of excluded immediate life-threatening injuries, which is good, but there can be lots of hidden stuff, so we still need to scan him from head to pelvis.
Having hit the windscreen with such force, John could have multiple injuries.
You're covered in blood. While we just wait for the scanner, I'll just clean you up a bit.
I've been an emergency nurse for 25 years, and you have to be capable in managing a person's worst day of their life. If you can offer help and be giving, there's an unbelievable level of personal reward that you can gain from that.
Better? That's all right.
Nurse Eliza has managed to track down John's 17-year-old son, Jack.
Do you want to talk to him? OK, hang on. Here he is.
Despite his alarming situation, John's careful not to worry his young son.
Hey, Jack, yeah, I'm all good, mate. Don't you worry, all right? Nah, my head's fine. It's, I just got, like, a bit of neck pain, bit of, like, sort of whiplash happening sort of pain. All right, take care. See ya.
Is he all right?
Yeah.
Yeah, drink of water.
To make sure he won't be in pain during the CT scan, Nurse Eliza gives him some medication.
Oh.
Does it hurt to swallow?
Back of my head.
Oh, the back of your head. OK.
When I give him the tablets, he grimaces so badly. It makes me think something's wrong.
Not your neck.
Very top.
It's a bit of a red flag for me because any severe pain in the neck, whether it's the back or the front, is not a good sign. I'm beginning to think that he's broken his neck.
He's all
You can't have any water at the moment, bud, because you've been in an accident and we need to make sure you're okay.
He's drinking water.
Dr. Nicola and the team are struggling to control 39-year-old Heath's pain after his leg was nearly severed in a crash.
Okay, can I just need someone to hold his hand while I give a little bit of ketamine?
Listen, we're trying to help you. Just keep still, okay? Just keep still, mate. Don't move. Please don't move. I know. You can because you have to, okay? So just breathe. He's had the strongest pain relief that we have available to us, which is ketamine. He is in insurmountable amounts of pain. It's really difficult. He's really scared.
All right, so let's try and get pain under control.
With Heath still in agony, Dr. Nicola decides on another course of action.
What do you think about intubating him?
Well, I think for situational control, we might need to do it.
Humanitarian reasons as well.
Yeah.
A bit more control. Yep.
He's in a lot of pain at the moment, so sometimes it's just better to put him in what we call an induced coma and put him to sleep.
Before they can put the breathing tube in, they need to make sure his lungs are okay.
X-ray. We're good. We're good.
With the all clear to intubate, Dr. Nicola calls on the experience of emergency doctor Jonathan Papson.
How you going there, buddy?
He's pretty ketaminised.
So it's a really serious thing to intubate someone. It's not undertaken lightly. He won't feel anything, but he also won't breathe, won't protect his airway. And within 2 minutes of us giving him the drug, unless we get the breathing tube in, he could be dead as a result of the medicine we've just given him. But we need to do it for Heath.
We're going to go for 70 of ketamine, 150 of brocuronium. We've got aramine in case we need it, but we'll also give blood.
Ready?
Okay, let's go.
Let's do it. Drugs are going in. So that's 70 of ketamine. How's that?
Lovely. You got the tube, Sarah?
Yep.
And fentanyl, thanks. He's intubated now. J-Pap, there's some fentanyl for you if you want some more.
Thank you. Just 50 of fentanyl as well. So the tube's fogging, you've got in tidal. Just try and bring the blood pressure down a bit. Probably need some propofol to bring the blood pressure down.
Propofol is here.
Great.
Got a good femoral pulse.
Blood pressure's fine.
Good job.
Heath's partner Nicole is anxiously waiting to see him.
They called me up and said, he's been in an accident. We don't know if he's all right. He's had leg trauma. So you don't know what's going on. You don't know if they're alive, if they're dead.
Do you think we can let in the other teams now?
With Heath now sedated, they can see if his mangled leg can be saved.
From plastics team, hello, how are you? Vascular, come on in. We thought we'd open it all up together with all three teams.
And do we have analgesics here and sedation running? Yeah, can I give you...
All right, should we take this down? This one first?
Yes,
I'll leave that up for a second to have a look.
It's a mess. He's got a mangled limb. If you picked up his leg, his foot may actually stay on the table.
I think we need to get him through the scanner. He might have to go to theatre for this. This one first, have a look. So this they described as penetrating from the bit of the cabin. What do we want to do with this?
I guess, strictly speaking from a vascular point of view, probably need the CT.
I'm going to slowly take the tourniquet down. We're just getting some packs ready.
This is a tricky moment for the team, taking off the tourniquet. Ideally, we take this tourniquet off in the operating theatre because that's a safe place where we can fix any problems that might occur. We're all a bit uncomfortable that he's going to bleed more, but we need to have a look. Maybe it's worth just getting the other unit and having it ready to go just in case.
Yeah.
Are you ready for me to take it down?
Yep.
Okay.
Are you undoing the tourniquet now?
I'm undoing the tourniquet.
Yeah.
Tourniquet's down.
All right, well, it's not hosing. We take the tourniquet down. He doesn't hose blood. He's just got brisk bleeding, which will be from veins or a damaged artery. Is he bleeding somewhere else? I don't know. The CT's going to tell us, hopefully.
What's his BP here? Saggy a bit. Do you want to just pump up it's a little bit damp to that trace? Yeah.
With the tourniquet off, the team work to stabilise Heath's leg before going into the scanner.
So, ready to reduce and put the slab on?
Yep, go for it. The tourniquet's down. We're going to need just another dressing, actually, on that, I think. Thank you. He's ready to roll. You lot ready to roll?
Once we've got the yellow
You
bag,
happy,
we're
Sarah?
ready to go.
Yeah, I'm happy. Yep.
Gent.
Gent.
Yep.
Yeah.
Gent was the plan.
Anything else we haven't done?
Thank you very much.
You better go, Dr. Walsham.
I'm going to go.
Thank
I'm
you.
going to go and hand over.
Yeah.
Dr. Jonathan and the team prepare to take Heath to the scanner.
We've got one more pack cell here.
Okay.
And we've ordered another one.
Good. Let's face it, he's pretty unstable. I don't want him to bleed out in CT. So I've got the blood ready. It's a little bit risky going to CT, but CT is going to give us more information to help him. Let's roll to CT and we'll continue to transfuse on the way. So we've got the yellow bag, red bag, EDA, antibiotics, ADT,
Ventilator?
sedation, ventilator. And so having got all that, I thought we could go to CT.
"53-year-old cyclist John is being scanned for neck and spine injuries after colliding with a van. The team is worried he has a lot of pain in his neck.
I'm just going to start the scan now. Keep really still.
Okay, well, this is his neck. Oh, my gosh. Oh no. That's very badly broken. He's lucky he can still move his legs and arms.
I'm quite shocked because I can see that the vertebrae are in pieces. It's not a crack. They're in a number of pieces.
Yeah, he's lucky to be alive and not completely paralysed.
With such a devastating scan result, Nurse Eliza keeps a closer check on John's condition.
You've got more pain now?
Yeah, I'm really uncomfortable.
Where?
Shoulders and
Shoulders?
neck and head.
Okay.
Dr. Andrew now has John's full scan report.
Oh, that's quite... Yeah, wow, that's pretty abnormal.
I'm pretty shocked by this that I'm seeing, really. This is a catastrophic injury. To be honest, he's extremely lucky he's made it to hospital even. He's got a fracture really, really high up in the neck. There's this sort of peg that sticks out of one of the vertebrae and then the other vertebra sits on top of it. And it's basically what allows you to turn your head from side to side. And he's snapped this basically clean off. The spinal cord is running right through the middle here. So if those two move sideways, his spinal cord's basically cut at that level. And that would be a lethal injury that would certainly result in John dying. So I'm gonna have to try and express that to him.
To be honest, I'm not surprised you're hurting in your neck because we've just looked at the scans and there's actually a fracture in the neck. Yeah. Then the bone is broken. It is a very unstable fracture. You can actually die from that injury. Okay. And it will mean obviously staying in hospital, and that could be for some time.
It's not the news you want to hear, but it's what it is.
Still nothing to eat or drink for now. Okay, just in case they need to do any surgery tonight.
It's tough to know whether he ever will get back to normal. These kind of injuries can be life-changing. At the very least, he's going to have chronic neck pain. He might have reduced movement in the neck. I think he's stable enough just to be able to go to a normal ward. From here, he's going to need lots of attention from orthopedics to look at his neck. He's going to need the trauma doctors to look at other injuries. They're going to need to sort out how they're going to fix all of these broken bones.
All right, good man. I'll see you later.
Deputy Director of Emergency, Dr. Steve Pincus, is back after taking a break from life on the front line.
Hey, Connie. How you going? Yeah, not bad, not bad.
Happening, where you been?
I had 3 weeks leave.
Hey!
I've never taken long service leave, so I figured, bugger it, I'm going to take a month of long service leave while the weather's still enough. Oh, wouldn't have no clue, but I've been here for almost 30 years.
What keeps me working in emergency medicine after all this time is that I can see something every day that is different, interesting, exciting, and even sometimes surprising.
17-year-old Tian, or Tom as he's known, has dislocated his jaw and has been brought in by his worried mum Mei Ling and brother Morgan.
So I just received a phone call from Tom's teacher. Basically, he yelled and it's all of a sudden it cannot close his mouth.
Unable to speak, Tom's been talking by text.
Oh, I feel a little worried, but everything will go fine. Oh my God, year 12 first day at school.
Goodness.
Very unusual.
Emergency registrar Dr. Michael Conboy arrives to help the teenager.
Hello. Has this happened to you before? No, OK. We'll be getting the jaw back in shortly. Tom's jaw's been out for 5 hours. He's got a lot of swelling and a lot of pain. The longer it's out, the worse it gets, but it's quite a tricky procedure. There's very much a knack to it.
It's not straight down, it's sort of that rotatory...
Yeah, like kind of rotating around, yeah.
And it's like levering.
Cool.
Dr. Michael hasn't had a lot of experience relocating jaws, so Dr. Steve will mentor him.
I'll come there with you. How do you do it?
So yawning.
Yeah, that's usually how you do it.
Yep.
Side top drawer. There it is.
Yeah, there we go.
Unwrap it and then wrap it into a ribbon.
Kind of like that.
And then fold it in half and then wrap it around your thumb. Otherwise you end up with really sore thumbs from pushing on their teeth.
Yeah.
It's like any mechanical job. You learn by doing. I can show him, but I want Michael to do this himself.
OK, my friend, spin yourself round and rest back. That's it. Tall, aren't you?
All right, I'm just going to put my thumbs inside your mouth on your teeth. Might feel a bit weird. All right. You all right?
So, thumbs on his back teeth, finger under the jaw, and it's sort of a twisting motion.
Sorry.
Dr. Michael can't get Tom's jaw back in.
When Michael fails, I absolutely know how he's feeling. It's not easy.
39-year-old Heath is about to have a CT scan after suffering horrific injuries to his leg when his tow truck collided with a semi-trailer.
The number's not good. Makes you wonder that he's bleeding.
Dr. Jonathan and nurse Sarah are concerned whether or not Heath's stable enough to survive the 10 minutes the scan's going to take.
Got a blood pressure of 85.
Yeah.
So your heart rate's going up, your blood pressure's going down.
Keep pumping the blood in.
He's incredibly unstable, primarily because of the blood that he's lost, but also we don't know what else is going on with him. In the pack that I'm carrying with me, I've got approximately 4 units of blood, and I have a feeling that we're going to need every single drop of it.
So we'll keep the fentanyl running because that'll keep him comfortable, and we've got group and cross-matched blood coming.
We've got blood coming, yep.
Because it looks like we're going to need it.
Yep.
Yeah. I suspect he's bled a lot more pre-hospital than we thought. And I suspect he's oozing, and that's what this is. We're pumping blood in to restore Heath's blood pressure, but I've only got a limited supply. I know we've got more blood ordered on the way. I don't want to run out in CT. That'd be a disaster. So, Sarah, you're going to take the head?
Yep.
Yep. Do you want to maybe take the leg?
Yeah.
Yeah, and I'll take this leg.
Have you got the oxygen there ready to connect?
All right, let's get across and get an answer.
Just as they're ready to scan, there's a problem.
What's up?
We can only get to above the ankles without the CO2 line being like really taut.
Oh, OK.
We checked up the top as well to give it some slack.
What are you saying? You can't scan his feet?
Well, yeah, just because we've got him so far up the table to try and get his toes on.
Okay.
He's huge as well. Like, that line's just not going to reach.
I can do the legs, but it won't be an arterial scan.
We need an arterial scan of the legs. Big person.
The technicians have a plan. They'll do 2 scans. First, Heath's upper body.
The only way it will work is if the monitor is on the table.
And then you'll have more length.
Then his lower body and legs.
Yeah, Abdul.
And we're done. 1, 2, 3. We good?
That's good.
All right, all the way over on 3. 1, 2, 3.
Finally, Dr. Jonathan can see the full extent of Heath's injuries.
They've given us a good picture, and his chest, as we thought, is okay. His abdomen, I don't see a major bleeding spot, but he might have some bruising in there. And his brain looks okay.
Now, Heath's leg.
Wow, look at that. So that's what we're dealing with. So his leg is sort of hanging on. Really nasty, bad injury. You can see the bones are disrupted there. They're all broken all the way through, and that's how he was trapped in the truck and squashed by the parts of the truck. That's why he was in such agony. Not only can the blood vessel get cut itself and bleed, but the blood vessel can not feed blood to the rest of the body, so it won't feed blood to the foot, which means you can lose your foot if we don't do this properly. Nasty. So when do you think you'll go to theatre?
Planning now, but probably just getting anaesthetics to come down.
Yeah, so not long. Great. Yep. Thank you. So this is a really catastrophic injury. Lots of muscles and blood vessels and nerves have been damaged in his leg. Even despite having all the experts, the vascular surgeons, the plastic surgeons, he is still at risk of losing his leg. It's just such a nasty injury. He's by no way out of the woods.
He's taken to theatre, where surgeons will try to save his leg.
So that split-second moment when his tow truck hit that car has changed his life forever. 1 second changes everything. It's an awful thing to think about, but that's what we see every day.
"17-year-old Tom is having a bad day. One big yawn's brought him into the ED, where Dr. Michael is still trying to get his dislocated jaw back into place.
Not really get anywhere with that. No.
Oh, no, we'll grab Danny.
Okay, grab Danny and go for the, yeah.
It's clear that both Tom is struggling and Michael's struggling to do it because we've got so much jaw muscle spasm that we're just not overcoming it. So I make the decision for Tom's comfort that we need to sedate him.
Dr. Steve needs the help of emergency registrar Dr. Daniel Perdomo.
Hey, you wanted to sedate this kid with a dislocated jaw. Okay, he's in trauma 2. We're waiting for you.
Sorry about that. Just wanted to give it a little try before we have to put you to sleep, okay?
Emergency nurse Liz Wheeler has been checking Tom's medical records and noticed he's been recently seen by a Royal Melbourne cardiologist.
Just to mention as well, he was here about a month ago with looks like a right bundle branch block, so I might do an ECG on him before we do anything.
No problem. Yeah, all good. Tom needs an ECG because if when we give him the sedation, if he's got any underlying heart problems, then they slow the heart rate down, they lower the blood pressure. It's important to check these things.
So which class did this happen in? Was it math? No? English? Literature? No?
With the ECG all clear, they can begin sedation.
How much do you weigh? 80? How much do you weigh? 70? 74. 74?
Show me with your fingers. How much do you weigh? Is that 5? And what's this? 65.
Yeah, 65 kilos. Might feel a little bit cold going up your arm, okay?
50 in?
50?
Just try to push it down. You're just trying to overcome the masseter muscles. It's this rotatory movement. You're trying to swing the jaw in.
Whilst you'd think that dislocated jaws are very common, they're not. So people are interested to watch, which absolutely increases the pressure on Michael.
Felt like it went.
Got it?
Not really get anywhere with that. No. I'm really putting a lot of force through his jaw. I'm trying to essentially move his bones. I'm pretty nervous at this point with all the people looking on and the fact that I've tried already and it hasn't quite worked.
Dr. Michael makes another attempt.
Felt like it went. There. Yeah, there we go.
This time, success.
Just check his teeth line up.
Yeah.
That's the giveaway.
That's okay. You're okay,
You're
darling.
okay,
You're
don't worry.
okay. You're okay. That's it. Well done.
I realise it's work when the jaw it's really a clonk. It's a big movement. How's your jaw feeling?
Not too bad.
I feel really relieved and I feel really validated as well. Like kind of, you know, I've done a good job here. I'm super relieved because it's so unpleasant to have your jaw like that for 5 hours. You're just coming around. Don't worry. It's just the drugs. Your jaw's back in now.
Oh, really?
Yeah.
It's over?
Yeah, it's all over.
Oh, yeah.
No more yawning though, so lots of caffeine, keep you awake.
How bad is your pain right now?
I rated a 0 out of 0.
0 out of 0. So you've got no pain at all in your jaw?
Thank you, I did not even realize.
That's wonderful.
My advice to Tom, maybe try and yawn with your mouth closed in the future.
After a quick coffee break, Emergency Registrar Dr. Andrew Wallace is heading back down to a busy ED.
Hello. Anything coming in?
There'll be him soon.
Yeah.
Girl is falling for the hospital.
Cool. Do you know what trauma bay they'll be in?
His next patient is coming in by chopper from rural Victoria.
She's had a big fall off a horse and she's been in so much pain she's not been able to get up off the ground. This girl could be paralysed.
I've only been forced to go on a horse once. That was a fairly frightening experience.
I know what happens when people get on horses. Absolutely not. When I was little, I raised to beg my mum and dad for a horse. But I think since working in emergency and just seeing how much damage horses can potentially do has really put me off.
Air ambulance touches down with 22-year-old Molly, who's suffering extreme pain after being thrown from a horse.
Oh, here they are.
Okay, so collar and pelvis is bound.
The law student and champion rider was training with her horse when she fell.
1, 2, 3. So this is 22-year-old Molly. So she was riding a horse. We'd gone over a small jump and then the horse's butt. And she said that she was going at sort of cantering/galloping pace and she's fallen onto a dirt track. She has hit her head. The helmet was essentially undamaged. She had immediate pain to her hip and she remained lying supine on the ground until the ambulance arrived.
Molly's boyfriend Patrick was filming when the horse threw her.
It all happened really fast. Kind of just jumped the fence and ran in to see if she was all right, and yeah, she was not okay. In a lot of pain, just on her back, on the ground. One leg was kind of up in the air, the other one off to the side, and yeah, couldn't really straighten them out too much just because it hurt so much. So it's just trying to get her as comfortable as possible.
Your helmet. Open your eyes for me. Follow my finger. Can I help your vision doing that?
Molly's been riding since she could walk, so she knows the joys of the sport and the risks.
She's fallen quite hard, quite fast onto probably really tough ground. We know that significant injury to the spine can cause severe pain, and also her pelvis. Pelvic injuries can be life-changing.
Good afternoon. Could I get a mobile pelvic and chest x-ray, please?
Pretty bad. Yeah.
The passionate rider's been hospitalised 4 times with injuries from the sport, and every time, pain management has been a problem.
Molly's quite sensitive. I think previously morphine and fentanyl's caused you a lot of nausea, is that right?
Yeah.
Yeah, and just lots of vomiting?
Yeah.
Yeah.
And I'd rather just deal with the pain than have it.
Yeah, sure.
To look for any of those major fractures that could be causing her pain, we want to take x-rays of her chest and her pelvis.
That's right, her pelvis. X-rays. Everyone who's not in lead, get out.
All right, Molly, deep breath in. Relax, breathe out.
Looking at the x-rays, I can't see any major fractures, which provides me some reassurance, but not enough that we can't get away without doing a CT scan of her back.
So we're going for CTs.
Okay, easy.
Thank you.
Molly needs a hard collar to protect her neck in case she has spinal injuries.
How's that feel, lovely? Can you do a big swallow for us? Too restricted? Sounds okay.
Dr. Andrew has found a possible alternative to relieve Molly's pain.
Have you ever had endone before?
Yeah.
Was that okay, or did you get the same nausea and vomiting?
And that was okay.
That was okay. Okay, maybe we can give you some endone, actually. Like, it's same but different to fentanyl, but if you've had it before, then I think that'd be a good idea.
Okay.
They need the pain medication to kick in before she can go to the scanner.
Hi there, Molly. How you going? You're sore. Yeah.
Yeah, like immense pain in my pelvis, which is the same spot where this same horse has kicked in the past.
Her horse, called Mr. Positive, is a powerful ex-racer she rides whenever she can.
I mean, I still love my horse. It doesn't matter what he does to me, I'm still gonna love him.
If you had to give your pain a score out of 10 at the moment, what do you think it'd be?
10.
A 10. All right, no worries. I might try and get you something a bit stronger than the endone as well, okay? Yeah. I ask Molly what her pain score is out of 10, and Molly tells me that her pain is a 10, which is concerning because nobody should ever feel like they're in 10 out of 10 pain. Did you want water or just... Nah? Oh, goodness, you're a trooper. On the count of 3, we're rolling all the way across. 1, 2, 3.
She could have sustained a big injury that we can't see with the x-rays. We've got to find out if there's any spinal cord injuries. Until we've got those reassuring CT images, I won't be completely relaxed about it.
With her mum still on the way from the country, it's an anxious time for Molly, waiting to find out if she'll ever ride again.
Mum should Nellie be here? I think so. Hopefully, yeah. Everything feels better when Mum's here, isn't it? At this moment, with how overwhelmed Molly's feeling, she must just want her mum. Even at 26, when I'm feeling unwell, all I want is my mum. Alrighty, you've got your buzzer, so you'll sing out if you need us. Thank you. No worries.
Finally, Dr. Andrew can see what injuries Molly has.
The neck looks good. Let's look at your chest. That all looks good. Hello. Good news, scans looking at your head and your neck or back, they're normal. Just so want to see how you feel. I'm going to take the collar off.
Yes, you can go to the toilet.
How does that feel? Just move slightly left and right.
That's fine.
Cool. Just lift your head up off the bed very gently. Okay.
I'm reassured that there's no major injuries and that we've got our pain under control. My suspicion is Molly may have sustained a form of neopraxia, a temporary injury to the nerve. It's very painful, especially at the very start, but it will improve with time.
Molly can now leave the ED and go to a ward for observation.
With that sort of fall from the horse, Molly's incredibly lucky. And hopefully, excusing the pun, she can get right back up on the horse.
I can't feel my legs!
39-year-old Heath suffered horrific injuries when his leg was crushed in the cabin of his tow truck.
So this is a really catastrophic injury. Even despite having all the vascular surgeons, the plastic surgeons, he is still at risk of losing his leg.
Even as he was being wheeled into surgery, there was no guarantee doctors would not have to amputate. After 7 operations, Heath is finally at home with Nicole.
Hello, mates.
And trusty companion, Tank.
Park it, thank you, good boy. I was pretty drugged up, so I don't think it really hit me straight away. Like, I didn't think it was that bad until the surgeons and that come around and said, like, it would have been easier for him to cut my foot off because it was just sort of hanging there. Then I sort of realised how bad it was.
Heath may need more surgeries and faces a long rehabilitation, but is determined to get back to work.
And I think it's supposed to go on the other side of that. When he says to me that he's going to be back at work by December, that he'll be back in the truck and he's going to be towing, I know that he'll be doing it again. It's what he loves to do. Like, if it makes him happy, it makes me happy.
Oh, I'm probably doing the wrong thing. I'm grateful for everything the Royal Melbourne's done for me. I'm glad that they went above and beyond to keep it. Yeah, they've done a good job. Amazing job.
22-year-old law student and champion rider Molly was in excruciating 10 out of 10 pain after being thrown off her horse.
I mean, I still love my horse. It doesn't matter what he does to me, I'm still gonna love him.
Dr. Andrew was concerned her pain could be a sign of spinal injury.
Until we've got those reassuring CT images, I won't be completely relaxed about it.
After a night in hospital, Molly was given the all clear to go home. Following doctors' orders not to ride for 2 months, Molly was back in the saddle exactly 8 weeks and 1 day later. 17-year-old Tian yawned on his first day back at school and dislocated his jaw.
Has this happened to you before? No, okay.
Tian needed sedation. Dr. Michael was finally able to get it back into place.
Your jaw's back in now.
Oh, really?
Yeah.
It's over?
Yeah, it's all over.
Oh, yeah.
He was soon back to school and will certainly be more careful when he yawns in future. 53-year-old John had an accident cycling home from work.
All right, mate. Any pain?
Yeah, my neck.
CT scans revealed a terrifying break in his neck.
He's lucky to be alive and not completely paralysed.
The retail worker didn't need surgery, but wore a neck brace for 4 weeks.
$20 at Aldi, best buy I've ever made, right?
It's been 13 weeks since the father of one's accident.
It's not a day goes past that I don't think, I just think, so lucky. And I'm just going to do what I can to get myself right. You just want to get on the bike. You just want to get even back to work. I was looking forward to snowboarding this winter and I'm like, OK, I'm not going to do that this year. So I'll aim next year. I'm feeling really good and just so thankful to everyone, without all the doctors and nurses and surgeons, what they've done for me. I wouldn't be where I am now.
Hello, Royal Melbourne. We're coming to you with a 28-year-old male. He's come off a ladder platform about 6 metres down with impact to his forehead, face, arms, possibly his chest as well.
Emergency Dr. Scott Taylor has just started his shift.
Hey, did you delegate this trauma to somebody? Not yet. OK, I'll take it. Yep.
We've just taken a call about a young guy who's fallen an estimated 6 metres off a ladder. If he's fallen and hit his head, he may have some injury to his brain. We just don't really know until he's there in front of us.
Great, is there trauma coming in here?
The patient is 28-year-old Borcher, a tradie who has lived in Australia for 8 years after moving from Macedonia.
Hi there, mate. What's your name?
Borcher.
I'm Scott, one of the doctors. We're going to be looking after you, OK?
On go, ready, set, go.
1 in 5 men who fall from a ladder will have a resulting spine or brain injury.
So this is Borcher, 28-year-old male patient.
The team waste no time scanning for internal bleeding and any other life-threatening injuries.
He was working on a scaffolding on the outside of a building and has fallen approximately 5 to 6 metres. He's landed on his forehead with his hands outstretched and landed on his right-hand side.
You know what?
Borcher's pain could be a sign of a major spine injury.
So we'll organise some pain relief, full spinal, CT pan scan bloods and go from there. Just to summarise all that for everyone's benefit, there's some ongoing concern for a potential head and neck injury.
The trauma team finished the initial ultrasound.
His fast scan's negative, which means we don't need to rush him off to the operating theatre. So we're not sure at this stage whether he's actually got an injury to his brain, but I highly suspect that he's going to have some kind of injury to his neck.
I might get X-ray just to come round.
Borcher needs an urgent CT scan to check for neck and spinal injuries. But Dr. Scott must be certain it's safe to move him.
OK, X-ray, thank you. Good, thank you.
See anything? They mentioned maybe some subcut emphysema in his neck.
I couldn't feel any subcut emphysema, but I'm just wondering whether it's
That's bone.
just bone. Yeah.
Could be. We'll get you for some more scans in a minute.
With Borcher, I'm expecting that he's going to have some kind of injury to his neck, whether that's a fracture or a dislocation, and that's something that could potentially be catastrophic for him.
What do you do for a job that's got you up 5-6 metres in the air?
I install shutters.
You install shutters.
As Dr. Scott organises the CT scan, the hospital tracked down Borcher's stepbrother, who is now on his way to the ED.
But more so here.
Experienced emergency nurse Susan Hartman knows that keeping Borcher's neck stable could save his life.
Is that comfy? Can you swallow that?
Yeah.
Still swallow, still breathe as normal.
Yeah.
Still secure.
Standard procedures after such a fall, we take full spinal precautions, put a collar on him,
and lay him flat.
With Borches's neck now stable, he can be moved.
We do need to take him from the trauma bay through the CT scanner, which is risky in itself because we're taking patients away from what's a stable and controlled environment of the trauma bay to an environment that's very small, that doesn't have the equipment that we need should something go wrong.
Amazing, thank you very much. They're ready.
If you have a name like Jonathan, right, you know, get used to a life of nicknames. You know, John, Johnny Boy, JJ, John, J-Man.
Senior emergency doctor Jonathan Papson loves a bit of banter.
So Emma will call me J-Pap sometimes, right, for example. When she calls me Jonathan, whoa, that's big trouble. It's like she's telling me off. Did something wrong. Yeah.
Dr. Jonathan's fun ends with news a trauma patient is on the way.
We're bringing you a 63-year-old male that was involved in a high-speed boating accident.
With over 20 years' experience in ED, Dr. Jonathan has seen the damage caused by every type of crash.
High speed, and he's in a boat.
Yep,
yeah?
that's correct, and submerged though.
So we've heard there's a high-speed boat crash, and we know that the driver has been submerged underwater for a period of time. What does that actually mean for him? Does it mean he's half drowned? Is he semi-conscious? Are his lungs full of water? So I'm trying to get a picture in my mind of what happened in this crash. Do boats go at 200 k's an hour?
Yeah, some of them do. High speed. Some of the high speed, like racing boats. Yeah.
See, we're getting more information now.
He had to be pulled out by divers.
Pulled out by divers. That doesn't sound good.
Father of two Andrew was leading a race when he lost control of the powerboat he was driving.
It's racing at
Yes.
Melton Weir.
All right, racing at Melton Weir. Now we're getting the story where there would be divers because you get accidents and crashes. Yeah. Is this a motorboat person?
Correct.
Right, okay.
3, 1, 2, 3.
Oh, breathing.
Down, 2, 3.
What you got?
Approximately 11:50, he was in his boat travelling at 200 kilometres per hour. He's lost control of the vehicle, was crashed, quickly submerged.
Does that mean it flipped over, or does it?
No, I think it just spun out and then sinks.
Hello, sir. What's your name?
His main complaints are left shoulder pain, bilateral elbow pain. That's it.
We'll get some x-rays done.
Hello there.
How you going, mate?
I'm good. My name's Jonathan, one of the specialists. You're where are you sore?
Mainly my elbows.
Both elbows hurt. Yeah.
Elbows.
Yeah.
Are very sore.
And why do you reckon your elbows are sore? Was it from hanging onto some sort of steering wheel or something?
I think the impact when I was hanging onto the steering wheel, maybe.
Yeah. Yep. So a lot of the time when we're dealing with trauma, we're looking at what the mechanism is and how it makes sense with the injury. He's got sore shoulder, sore elbows. I think the term is you're hanging on for dear life.
Andrew, a swimming pool installer, has travelled from Newcastle in New South Wales for the boat race in Victoria.
Wife's at home.
Does she know you're here?
Yeah, they contacted my wife and my son.
Andrew reveals this isn't his first serious water accident.
Well, I've had a broken C6 vertebrae before.
Was that from a crash?
No, I was on a boogie board with my 6-year-old niece.
That's one way to go.
Water related, yeah. It's no surprise to me he's had a broken neck in the past. Would I call Andrew a daredevil, a guy who gets in a boat and drives it at 200 k's an hour? Yeah, I reckon that's a daredevil. Not being boating experts, I don't really understand the concept, but you're in a capsule. Right?
In a fully enclosed capsule.
Yeah. And then the thing goes...
5-point harness.
And then you crash. And it sinks. I'm concerned about the time Andrew spent underwater. Did he just hold his breath and then jump out, or was he fully submerged, totally underwater for ages? So, Jane, the lungs look fine on ultrasound. There's no pneumothorax, there's no hemothorax, and his oxygen saturation's good. It doesn't look like we're dealing with what we would call a near-drowning incident. This is more of a trauma to the chest situation.
I've got an air mask on in the boat.
Yep. So it wasn't like you were underwater with water flooding your lungs or anything?
No, definitely not.
And the divers get you out, but you're not actually underwater when they got you out?
No, I was already on top of the water.
You're on top of the water, yeah.
So Andrew tells me he's actually got an oxygen mask and an oxygen supply as part of his kit when he's driving the boat. That makes a lot of sense. And now I understand why his lungs are okay.
We're just going to check to make sure your back's not broken.
Yeah.
You just keep your head nice and still. Sorry, Andrew, I know it's not comfortable. All right, on my count, 1, 2, 3.
Very good. All right. Is it sore right in the middle where I'm pressing?
No, it's nothing there at all.
Not here?
No.
Here?
No.
Here?
No.
We log roll Andrew, feeling down the middle of his spine to feel for a fracture in his thoracic and lumbar spine. It actually feels all right.
Thigh bone pain?
Yeah.
Concerned about Andrew's obvious pain, it's a careful process of elimination for Dr. Jonathan.
So the next step is now to go to the CT scanner and look for any other injuries, like the back of his shoulder, the shoulder blade. We're still worried about his neck, but I've got him in the collar, so it's not going to get any worse.
I wonder...
elbow.
Elbow.
I wonder if he's ruptured the biceps tendon.
The bicep muscle has been detached off the bone.
Previously.
Right, yeah.
4 years ago. Yeah.
That's his problem, sore elbows. It's a jarring sort of thing.
Is it sore at the front?
No, you can press it.
The trouble is that's distracting him from other stuff as well. So, yeah, your elbows are sore, but have you got other injuries? Maybe. So we are going to treat this very seriously.
Any high-speed crash, people can break their neck. So he may have a spinal injury, definitely. And by that I mean they could become a paraplegic or a quadriplegic. This is the worst-case scenario.
What's your name?
28-year-old tradie Borcher has been sent for a CT scan after he fell 6 metres off a ladder onto his head.
On 1, 2, 3. There we go.
He's complaining of neck pain right higher up, and the higher the injury that you get, the more severe complications that can occur.
The scan will reveal if the simple act of climbing a ladder has changed Borcher's life forever.
Please breathe in and hold your breath.
Nurse Susan anxiously waits for the results to come through.
It's fractured right through there. So that's C2, that whole block is C2, C1, and it's fractured right in half. That's quite a high spinal fracture, so you'd be very concerned for neurogenic shock, so it's quite serious.
The results are the last thing that Dr. Scott wants to see.
Oh, man. Oh, so he's fractured through his C2 vertebrae and it's shifted backwards into his spinal canal. Oh, man. This part here should be sitting on top of that, all as one bone, but he's smashed that right off. Oh.
What we're seeing is a fracture at the bottom of the C2, and that fracture's tipping backwards, which reduces the amount of space in that spinal canal and can cause some pretty significant problems as far as people's ability to move their arms and legs, but also their ability to breathe. It's certainly a worst-case scenario here.
Everybody ready? 1, 2.
The slightest head movement could sever Borcher's spine.
And what level is your pain now?
Checking for other injuries now takes on a new urgency.
We'll help and take you around with X-ray for your ankle, okay?
Nurse Susan closely monitors Borcher to make sure he keeps breathing.
Still okay?
Yeah. I can't breathe, you know, like...
You can breathe.
It's hard.
You mean it's hard to breathe? Just slow deep breath. Okay, love?
As the radiographers begin X-raying, Nurse Susan grows increasingly concerned.
You can't feel getting the air in, or...?
Yeah, like... See, it's like hard to not...
Try and do it slowly, all right? You tell me if you can't get your air in, okay? So he's finding it difficult to breathe. We've got to get back to trauma as soon as we can. Every second counts, every second.
How about not put a bit of oxygen on me?
Having difficulties breathing, even though it's sensory.
Yeah, he's got a displaced dens.
Dr. Scott is rushing to 28-year-old tradie Borcher, who's broken his neck in a ladder fall and is now having major difficulty breathing.
You guys okay here?
Well, I'm just a bit troubled.
Yeah. Yeah. Borsch, you've got a pretty significant injury to your neck.
Yeah.
You've broken your neck.
Yeah.
And it's probably putting pressure on your spinal cord.
Yeah.
All right. That's right at the level that controls your breathing.
Ah.
I'm very worried for you, my friend. I'm really sorry. I'm really worried.
Yeah.
It's certainly possible that he might become a quadriplegic with this kind of injury. Breaking bad news is always tricky. I'd like to say that it gets easier with experience, but changing somebody's life with news of that magnitude is not an enjoyable part of the job. It still breaks your heart every time.
I need to talk to a few people urgently.
Yes.
We might need to do something to put you to sleep for a little bit and support your breathing with a breathing machine.
Yeah.
Okay?
Okay.
This is an emergency. We need to urgently take control of his breathing by putting a breathing tube into his throat and putting him on a ventilator that'll breathe for him. Things can go from looking okay and just having a fracture to being a quadriplegic or even dead very, very quickly.
Oh.
I might give anaesthetics and ICU a call now, I think. I was wondering if we might be able to enlist your services. We have a 28-year-old down in Trauma 1 who's now feeling short of breath. We think he needs an early tube.
You can go and say hi.
Borcher is still reeling from the shocking news when his stepbrother Darko arrives.
He looks worried, and that's what worries me. He just tells me that he has a broken back. I don't know whether he's going to be able to use his limbs like he could previously. I don't know that he's going to live at this stage. I just know that it's going to be very serious.
How's your breathing?
It's okay. Put this.
Bit better with the oxygen?
Yeah. If you can, put more oxygen.
More oxygen?
Yeah.
Okay.
You don't feel it?
Yeah, okay. But you feel like you're having to breathe with your tummy and your chest?
In my mouth.
The team must take over Borcher's breathing to save his life.
It's important that we get this breathing tube in as soon as possible before things get worse. For this, I want our anaesthetics team in the room and ideally doing the procedure. We want our most skilled and experienced hands on deck.
We're just kind of preempting things, knowing that we're going to need an MRI. I don't want him to deteriorate while he's in the MRI machine when we can't do anything about it. I want to crack on and do this before he really runs into trouble.
Yeah.
Hi, Royal Melbourne. We're coming in about 10-15 minutes with a 35-year-old female. Cyclist versus car. We've had a head strike with loss of consciousness and some retrograde amnesia with a GC.
Emergency nurse and resus team leader Gunnar Pedersen has just learned an ambulance is rushing to emergency carrying a woman who has been knocked off her bicycle.
The first thing I hear, cyclist, car, no helmet. The first injuries that I think about are head injuries, because they are the most dangerous things that you can bleed to death from. Humans are not made to have an impact with metal objects. ETA about 10 minutes, guys?
As Gunnar readies the trauma bay for all possible scenarios.
All right, so cyclist versus car.
The ambulance arrives carrying 35-year-old Mylen. Originally from Argentina, Mylen now works as a filmmaker in Melbourne.
No seizures en route.
No seizures en route.
Yeah, just on scene.
Immediately after the accident, she has a seizure. That is a major worry. That means that there's been a significant impact to the brain, something that's affecting the structure of the brain and the electrical function of the brain.
Ready, set.
Leading the trauma team is senior emergency doctor Jana Alexander.
So this is Malene. She's a 35-year-old female cyclist first car. She was a cyclist travelling approximately 15 k's an hour, was not wearing a helmet. She has had a head strike as well as a seizure lasting approximately a minute. She appears to have a head laceration coming from her head, unsure where, due to the amount of bleeding. She also appears to have a dislocated left thumb. Injuries. This is not what I need.
With Mylene bleeding heavily from the head, Dr. Jana is worried about other, possibly hidden injuries.
My main concern with Mylene is that she wasn't wearing a helmet. She's got a lot of bleeding from this big wound on her head, but also what it can suggest is bleeding on the brain. Depending on how severe the bleed is, it's potentially life-threatening. In her case, it could be significantly debilitating.
Just gonna check your pupils. Can you open your eyes for us?
The accident happened as a car attempted to overtake Mylene on the e-bike she had rented to travel to work.
Are you sore anywhere at the moment? In the head.
Mylene's severe head injury means the trauma team can quickly deploy extra resources if needed.
She's been upgraded to a trauma call for blood pressure of 85.
Ow!
So the moment that I hear that Mylene has been upgraded to a trauma call, that means that everything has escalated. I need more staff. I need more equipment.
It's trouble. She might have a big laceration there.
Mylene has been bleeding so much from her head that her matted hair makes it difficult to see the wound.
We're just trying to identify the source of bleeding at the moment.
Yeah.
Don't move your neck.
It's essential that we keep her immobilized, so we call that spinal immobilization, where we put a collar on the neck. If she's got a neck injury, any movement could potentially cause a spinal cord injury, which would be devastating for her.
Try not to move your neck, okay? It's really important. Just in case there is a fracture, you could be paralyzed if you move it.
Do you have any problems with your kidney or thyroid?
No.
53-year-old powerboat racer Andrew is having a CT scan after a high-impact accident may have left him with a life-changing injury.
The CT is there to rule out all the nasty injuries that I'm worried about, like broken ribs, broken neck, broken back. That's what the CT is going to show me.
Anyone can support that right hand.
Andrew's friend and fellow racer Warwick has rushed in from where the crash happened, over 50 kilometres away.
I saw it happen, the barrel roll, but I can't explain why it happened. I thought the worst, as you instantly do. It's pretty bad.
I've been looking for you.
Oh, okay. It's time
There you go, was it? It's a wake-up call,
What?
Yeah, I'm done.
Hey?
You're done?
I'm done.
You're not going to do it again?
I'm not doing it with you if you do.
Andrew's wife Marissa
Yeah, give her a buzz.
has been waiting anxiously at home to find out how severe his injuries are.
Hello? How you going, boss? I'm just laying here, just waiting on all the results, so I thought I'd give you a call. No, I'm thinking about that myself, but anyway, discuss it when I get home. I love you. Speak to you soon.
With the CT scan results in, Dr. Jonathan is surprised by what he sees.
This is the way your shoulder blade is supposed to look. It's not supposed to do this. It's not supposed to be in pieces. That's bad. Yeah, that's going to really hurt. Andrew has broken his shoulder blade, fractured his scapula, and whenever that breaks, that means a lot of force has actually gone through his shoulder blade.
Dr. Jonathan now has to break the terrible news to Andrew that his racing days could be over.
Your shoulder blade's sort of shattered in a few bits, so you're going to be fine, but you're going to be a bit sore. Are you sore?
Yeah.
This is going to end your career in speedboat racing. What are you going to do? You're going to keep doing it?
It's a sport that you're either in or you're out.
Right.
I've been in it my whole life. My dad was in it.
All right, I'll check in with you later on.
Thanks, you.
Andrew seems undecided if he'll ever take part again in the sport he so passionately loves.
Don't know. See what happens. It's a lot of money invested.
In financial-wise, probably not. Heart-wise, probably yes.
Amazingly, with that kind of injury, you don't need an operation. So we'll usually put people in a sling so it doesn't move, and then the body will heal it in place.
Morning.
Good morning, how are you?
Nurse Unit Manager Susan Harding oversees a group of colleagues like Paul Casey, known as nurse practitioners.
So a nurse practitioner is essentially a registered nurse who has done a higher level of education at a master's degree level, where they have the experience, expertise to diagnose and treat a number of patients.
Paul's journey to become a nurse practitioner started 10 years ago.
I always thought I was going to do something. My brother, Ben, is a nurse. And I said to him, if it's good enough for you, it's good enough for me.
His skills are put into practice with Nicholas, who's been rushed into ED by his girlfriend Sophie with a dislocated shoulder.
What happened?
We were just lying in bed. I have a slack shoulder already.
Right, okay.
And I had my arm like this, and Anso was there.
Yeah.
And we just moved, and it quite surprisingly came out the back.
His shoulder, it's obviously not in the right place. The longer that it stays out, the muscles kind of tense up and create more pain.
This isn't the first time Nicholas has dislocated his shoulder.
It happened probably like 7 times.
But this is the first time Nurse Paul has ever attempted to put a dislocated shoulder back into place.
I've been involved in many, but I've not been the man that actually pops it back in. All right, you have a chug on that for me.
Emergency Dr. Jane Hamilton is there to help if needed.
Just keep there.
Keep having a go at that.
Nurse Paul gives Nicholas nitrous oxide to help with the pain.
Just relax, let me move your arm, okay? The idea is to go up and then sort of rotate. So we're going in this kind of motion, rotating out, and then hopefully the joint just comes back in. Just keep breathing it, keep breathing it. Back in. Nice there, isn't it?
Not me. It's not me.
No, keep breathing that stuff. It's very frustrating for me because obviously I don't like seeing people in pain.
Years and years of muscle memory of being tense on this shoulder, and I think it's probably making the job a bit harder.
He may just need some sedation to relax the muscles.
Yeah, I think it is pretty tense there, so I think I'm thinking at the moment that we may perhaps need to sedate Nicholas. There's a lot of complications that may arise in doing so, so it's our last resort in a scenario.
Can I say something?
Yeah.
Yep.
It happened once before, and they tied a sheet around me and held me from that side,
Okay.
and then pulled me that way.
Right.
If he's had success with that before, then we can give it a try. So he's kind of the expert in this way rather than us.
You just sort of thread that in underneath.
Under...
Yeah, just under, yeah, that's it.
Under there, yeah. We put a sheet under his shoulder and someone's applying some traction from the other end. I'm going to go down and up and out on it.
Sorry.
The sheet method doesn't work.
Not really budging, is it? Sedation, yeah.
I want to crack on and do this before he really runs into trouble.
28-year-old tradie Borchair is fighting to breathe after breaking his neck and damaging his spinal cord in a fall.
Hand in your neck still. He's got a breath.
Borchair needs an urgent MRI scan, but he can't be moved until he's intubated,
I'm going to get anaesthetics to tube.
a process that will help him breathe when they induce a coma.
If we weren't to intubate him at this point, we'd be taking him to an MRI scanner where he's away in a very small, confined area where we can't get to him in a hurry. And if that bleeding around his fracture were to get worse, his heart rate might drop very low or stop.
Here now. Yep. Hey guys, thanks for coming down.
The anaesthetics team arrive and the intubation procedure can now begin.
Oh, mate, it's going to be sharp sting in your wrist here.
You're okay? You doing okay?
Yeah.
So, intubation, Scott's going to do drugs, Mark's going to be primary airway.
Intubating someone's a very risky procedure and can be technically quite difficult in somebody who's got an unstable injury to their neck. We need to give him some medication to put him to sleep and keep him still before we do the procedure.
Beautiful.
Good.
We are happy with
Is everybody happy to start?
Okay.
Yep.
Any distraction in the high-risk procedure could be fatal. Our main cameras leave.
So I'm going to give 150 milligrams of ketamine, followed immediately by 150 milligrams of rock uranium.
How you going there? You all right?
Good. You watching that clock?
I am.
Beautiful.
There's about 45 seconds to a minute after we give the medication where he stops breathing. And then once we take away that ability for him to breathe on his own, we need to get the tube in as quick as possible. Because he's not breathing on his own, he's not able to get enough oxygen in. That can be really dangerous if his oxygen levels drop at that point.
That's good. 45 seconds.
Sats are 100. You've got end tidal.
If something goes wrong and we can't get the tube in through the mouth, then we need somebody who's going to be able to step up and cut the neck and put a tube in through the front of the neck. And in this situation, it would have to be me.
Take out the stylet for me, please.
Great job.
With the tube now in, ball chest breathing is taken over by a ventilator.
Beautiful.
Thank you, guys. Great job, everybody. Really, really good job.
Let's get that sedation up and running.
Yep, already going. This man's gone from one day being perfectly healthy and fully functioning, and the next day we don't know what's going to come of this.
From here, he's going to go to the MRI scanner. Once that's done, he'll go up to the intensive care unit. At this stage, it's too early to know whether he's going to make a full recovery or not.
I suspect he's probably going to need an operation, and he could be quadriplegic and in a wheelchair forever. He could in fact die from these injuries. This is life-changing stuff for this guy.
Try not to move your neck, okay? It's really important. Just in case there is a fracture, you could be paralysed if you move it.
Bike rider Mylen has a severe head injury and a possible neck fracture after being hit by a car.
Can I get you to take Resus 5 to CT urgently?
A major trauma has just arrived in the ED. Nurse Gunnar is called away to help.
Oh, good, mate. Give me a shout if you need me.
And Dr. Jana's vast experience is also urgently needed. Emergency Dr. Zahir Jayhoon takes over Mylen's care.
What we're concerned about is the fact that you've had this seizure when I don't think you normally have seizures, do you?
A seizure is essentially a disruption of the nerve signals in the head, and what that means is that she suffered a big knock as she's hit the ground.
Sometimes what can happen is after a head injury, there can be sort of injury to the brain.
It could also mean that there's a potential for there being bleeding in the brain, bruising in the brain, or with the blood loss that she's got, potentially even a skull fracture.
We'll do a CT scan of not just your head, but also your neck, chest and abdomen as well.
Like anyone who's suffered a major accident, Mylen wants her loved ones around her.
I can sense that she's quite afraid. In our time of need, we so desperately want to be around those that are close to us.
Do you have a partner or a friend that you want us to tell to?
They manage to track down her ex-boyfriend, Max.
I had an accident. I rented one of those bikes. Someone calls me with the cops. I called you because I would like for you to be here. I don't know what was it called.
The magnitude of her accident is a lot for Mylen to take in.
Has anyone seen your thumb? No. Have you had x-rays? No. Okay, I'm going to get some x-rays for that.
As well as the troubling head wound, Mylen has a severely dislocated left thumb.
So you can put your arm out nice and straight. Do your left hand and your right elbow.
Dr. Zahir can now see the extensive damage to Mylen's hand.
What we can see over here is that the finger, which should be nice and straight, is very obviously bent. So she's got a dislocation of her thumb.
Understanding Mylen needs his support, her ex-boyfriend Max arrives along with her friend Gallen.
I'm in pain yesterday, but the seizure, that's stress me out a little.
The unfortunate decision not to wear a bike helmet could have life-changing consequences.
So in terms of the CT scan, we're worried about possible serious brain injuries. Because she's taken a big knock to the head, we're also worried about her neck, and we're worried about potential spinal cord injury.
All right, we're going to take off now, guys. See you back shortly.
3, 1, 2, 3.
35-year-old Mylene is about to be scanned after a bicycle accident with a car left her with a severe head injury and possible neck and spinal fractures.
Nice and still. This first part of the scan takes about 2 minutes.
The CT scan is of utmost importance. We're worried about a skull fracture, that we see a large bleed, that we see a major fracture in the neck.
While they wait for scan results, Dr. Zahir prepares to put Malin's dislocated thumb back into place.
Deep breath in and out.
Thankfully, Max is by her side.
Before we relocate her thumb, we have to give her some local anesthetic, and that's essentially some medication that will numb her arm completely.
Wonderful, doing really well. Focus on your right hand.
La concha.
Doing so well. So well. In through the nose, out through the mouth.
There we go.
Please.
Nice and straight. Look at that.
Woohoo!
Brand new.
The CT results will tell Dr. Zahir if Mylene has life-changing brain or neck injuries.
There's no obvious bleed. What we can see is a lot of bruising and that bleeding, that cut, which has caused all that blood on her face.
So in the CT brain scan result, what we see is that she's got a laceration to the side of the head. Reassuringly, it seems that the inside of the brain, there isn't any major bleed.
And then when we look at the neck, she's got a fracture up the top of the neck, which can be concerning in itself because it can cause injury to the spinal cord.
Her staying still is absolutely critical at this point because any unnecessary movement or could potentially mean that there's pressure that's put on the spinal cord, which could lead to, at its absolute worst, paralysis.
Along the neck, about towards the bottom of the neck, you've got a very small fracture in the spine. From what I can see, there's no injury to the actual spinal cord. Just for the moment, we'll keep that on. I will just do everything you can to keep nice and still. And then I'll speak to the orthopedic surgeons to get their thoughts on what they think we should do about what we need to worry about with the neck.
For now, Mylene will stay in emergency until the orthopedic surgeons decide on next steps.
Maylin has today made the decision to get on a rental bike because she needs to get from point A to point B quite quickly for work purposes. And unfortunately, the rental bike that she's gotten on did not come with a helmet. So she's made the unfortunate decision to take that trip without wearing one.
Sometimes it's good to go through these too. Remember how fragile we are?
Anything else I can do for the moment?
No, that's okay.
Yeah, that's okay. We'll catch up again soon, all right? Pleasure.
Really budging, isn't it?
Nurse practitioner Paul is grappling with the dislocated shoulder of 30-year-old architect Nicholas.
Let's try again. No. Sedation, yeah. Me and Jane, one of the registrars, have tried to get the shoulder back in. We are all trying to think of other methods of getting the shoulder in that don't involve sedation.
Realising he needs help with Nicholas's shoulder,
What's Chungi's number?
Nurse Paul tries calling emergency Dr. Sung Chung at the very same time as Dr. Chung pops in to see how he's going.
Oh, Chungi, we probably need to give him a bit of sedation. We've tried it with nitrous. Chung is like the invisible man who suddenly appears. He's a go-to person for me because I value his knowledge and experience.
Dr. Chung immediately offers a solution.
Just tell him on his belly.
On his belly?
Come over the side.
Okay.
I'm very happy that he sees me as this invisible man coming in. Hello, Chung. Nice to meet you, one of the other doctors.
Hi.
Have you ever done it this way?
Not that I remember.
Okay. This technique, lying prone, is my go-to technique. And I'm very comfortable, I'm very familiar with it. If this technique doesn't work, I'm going to have to sedate Nicholas.
Sure. I'm going to gently pull down on your arm, and Paul here is going to push on your scapula here, this way, okay? So just the wing, angle it that way.
Yeah.
We'll go gently. Push Paul.
I am.
Bit sore, are you, Nick? Try your best to relax.
As Dr. Chung pulls Nicholas's arm and Nurse Paul pushes the shoulder blade, they're hoping the ball of the arm will pop back into the socket.
Yeah. You tell me what you want to do. Okay. Oh, yeah, there we go. Felt that.
Okay, done.
Yeah, I felt that move then. Fortunately, it worked, and it was very satisfying because I could feel it go back in, and I'm sure it's very satisfying for Nick as well because he felt instantly better. How you going?
Yeah, good. Sorry for the ordeal.
No, it's all right.
It's just a different technique of putting the shoulder back in. And I think the patient did most of the work. It's just a matter of relaxing the muscles.
It feels good to have it back in. So thanks to the team.
I got a good outcome for the patient, and I learned something new that I hadn't known previously. So I was quite happy from that point of view.
53-year-old Andrew arrived at the Royal Melbourne after crashing the powerboat he was racing at 200 kilometres an hour.
Something just went wrong.
A CT scan revealed he had broken his scapula.
Your shoulder blade's sort of shattered in a few bits. This is going to end your career in speedboat racing.
A couple of days later, Andrew's in a sling and recovering with wife Marissa by his side.
The wife's not real impressed with me having another go at it, so...
He's not racing again. That's it.
There's a fair bit of footage of it.
I haven't watched it at all.
That's a bit scary when you sit back and look at it. How close I really was to probably not being here.
30-year-old architect Nicholas was brought into ED with a dislocated shoulder.
Back in.
Nurse practitioner Paul struggled to get it back into place.
Nice there, isn't it?
Not really.
And called on Dr. Chung for help.
Just put him on your belly.
On his belly?
Working together, they were able to relocate the shoulder.
Oh, yeah, there we go. Felt that.
Okay, done.
Yeah, I felt that move then.
And Nicholas and Sophie were able to go home. 35-year-old cyclist Malin was hit by a car and suffered a severe head wound as she wasn't wearing a helmet.
Are you sore anywhere at the moment? In the head.
The team feared bleeding on the brain and a neck injury.
Move your neck, move your neck.
A CT scan revealed bad news.
Along the neck, about towards the bottom of the neck, you've got a very small fracture in the spine.
And I'll speak to the orthopaedic surgeons to get their thoughts on what they think we should do about what we need to worry about with the neck.
Malin spent the next 3 days in hospital, where orthopaedic surgeons concluded the fracture would heal by itself. Malin flew back to Argentina to be with her family for 6 weeks and is now back in Australia. 28-year-old tradie Borche was rushed into the ED after falling 6 metres off a ladder. Dr. Scott feared the pain in his neck was a sign of a major spinal injury.
Oh man, he's fractured through his C2 vertebrae and it's shifted backwards into his spinal canal. Borsch, you've broken your neck.
Yeah.
I'm very worried for you, my friend. I'm really sorry, I'm really worried.
Yeah.
5 months later, Borche is at home recovering, with his stepbrother Darko keeping a close eye on him.
Good to be out.
Yes, thank you to the doctors.
The doctors put Borche into a halo head brace to keep his head from being able to rotate and to keep his spine aligned, as he'd fractured 2 or 3 of his vertebrae, and he had to be kept incredibly still for them to recover correctly.
Borche has showed incredible determination to get his life back on track.
From when Borche had his accident, he could completely do everything himself after 1 month.
How do you feel?
I am good.
Yeah?
Better.
Oh, good.
I think that this accident has made Borche more aware how quickly things can change in life and to seize the moment, but also maybe to be a little bit more careful next time.
Good morning, Royal Melbourne. I've got a 70-year-old male in a bike versus car. He does have a penetrating injury on the left side of his trachea.
Penetrating injury to his neck? What?
Looks like a piece of glass. We're not sure how deep it might be. We're not going to touch it.
But it's in his neck. We're hearing that a pushbike rider has collided with a car and he's hit the windscreen. He's got some glass sticking in his neck that makes us worried straight away because there's a lot of blood vessels in the neck that can get cut. Do you guys know where they put a trauma alert to this?
The patient is 75-year-old Hugh, who was riding his pushbike when a van reversed from a parking space and hit him.
Oh, well, I reckon it's more than what we thought.
Hugh, who regularly cycles over 100 kilometres a week, hit the back window of the van, shattering the glass.
Are you worried about his bleeding neck? We've got to be very careful and very attentive to this piece of glass that Hugh happens to have stuck in his neck and properly work out what structures have been damaged. Just go nice and slow because he does have a shard of glass stuck in his neck.
Rolling on 3. 1, 2, 3. Back 2, 3. Okay, just relax and we'll do it all for you, okay? On 3. 1, 2, 3.
Assisting Dr. Jonathan is emergency doctor Emmanuel Karpathakis, who starts delicately assessing Hugh's injuries.
This is Hugh. He's a 75-year-old male, lives at home with his wife. Was riding his bike when a car reversed into him, hitting his head on the glass.
Spare my hands.
Travelling at 20 kilometres an hour, cycling.
Okay, yes. So it's a sort of a low impact, but something cut his neck.
Yeah.
Yeah. So I don't think we're going to get a collar on him because of the neck wound. All the things I'm worried about live in the neck. If he cuts his carotid artery, he could bleed very quickly, can be in a lot of trouble very quickly.
My name's Ebony, I'm one of the nurses. How's your pain going? Hugh's facing a very scary moment because I don't think he even knows how dangerous and serious this is.
How did you go, Manny? What did you find?
So what we've got,
They quickly assess if he has any other injuries.
we've got an intact airway. He's breathing spontaneously on his own at the moment. And it appears that there is a shard of glass on the left side of the neck.
The fact that he's awake and talking to us without making any obvious gurgling airway sounds means that his airway's okay.
Hugh's wife Nolene was at home when she heard her husband of 44 years was in an ambulance heading to the ED.
The police rang and they said Hugh's been in an accident. My heart stopped and I couldn't believe it. It's just dread. You hope to goodness that everything's going to be okay.
I haven't taken that bandage down yet.
Let's do it.
Before to do it now.
Yeah, let's do it.
This is the first time they see if Hugh's injury could kill him.
I think... Oh, I see. That's what I thought I saw. Yeah.
Now, how much do you want me to...
Well, why don't we go everything apart from...
Don't move your head. Don't move.
We'll keep it in the spot. We'll take everything else off around it. Yeah. I'm not actually expecting a huge shard of glass sticking into his neck like, you know, someone stabbed him with a shard. It actually looks like that. So he's got that little thing there. Yeah. And he's got this guy.
There's got a bit of swelling up there too.
All right.
Is that clavicle or is that swelling?
Yeah, it's swollen, isn't it? Yeah. Oh, he's got a big hematoma.
Yeah. That swelling may represent active bleeding. That's a sign to us that there's probably an artery involved and we need to be dealing with this absolutely urgently.
He could have hit the vein, for sure.
I'm not touching it anymore.
No.
They know if they make a wrong move, the consequences could be catastrophic.
Where's that piece of glass? What's it sitting on? What's it next to it? It's a critical situation. How are you feeling there, mate?
I feel fine.
You've got this little thing sticking in your neck and it might have hit the vein. So we're going to get a scan and see exactly where that is before we pull it out. If the piece of glass comes out and it's actually sitting in the artery and plugging the artery and it falls out, he will just bleed like stink out of his neck, and he could be dead within minutes. So we're going to leave it in and scan it and then pull it out after that.
Try not to move that head of yours, all right? I'm constantly reminding him just to stay nice and still, try not to talk too much, because every time he talks, this piece of glass is moving as well.
Wow. That was worth getting worried about.
Does it hurt when you swallow?
It's just
careful. The glass there.
When Q is reaching across, that is certainly quite a heart-stopping moment.
Case numbers are starting to build. Paramedics arrive with mother of two Cindy, who's unconscious after a series of life-threatening seizures.
What's the patient in resus 6?
Emergency Dr. Michelle Thornhill acts fast. The 37-year-old's life is in danger.
I was just thinking, I wasn't noticing the colouring here because it almost looks a little bluish. When I lift the mask off, I think her lips do actually look a bit blue. It's actually a pretty ominous sign because it can mean that they're very low on oxygen.
Open your eyes for me. Open your eyes.
The team know it could be fatal if they don't get enough oxygen into her immediately.
This is Cindy. She's 37 years of age, works at Melbourne Airport, lives at home with her partner. She's had approximately 5 reoccurring chronic seizures with no return to consciousness between them.
So you go ahead, I'm just gonna come up here.
Cindy's partner is at home with their 2 young children, so can't be with her now.
All right there, give us some deep breaths. Cindy's status is life-threatening at the moment. If she doesn't get the critical oxygen that she needs and she keeps seizing, then she can have lifelong brain damage. She's localizing.
The young mother's seizures haven't stopped. She's deteriorating fast.
As soon as I identify the critical nature of Cindy's illness, I realize that I need more hands on deck. Martin, it's Michelle. I need help in resus 6. Thanks. Bye.
When your colleague says that they need a hand, you drop everything and go.
Can you just take that phone and hang it up for me? All right, and then I need someone to back. Yep.
If they can't get enough oxygen into her, Cindy's life is at risk.
What's Martin on here?
Hi. So this lady, 30-something, seizure history, had basically status epilepticus, about 4 or 5 recurrent seizures, didn't recover.
We've got a seizure.
Yeah, so we're definitely going to proceed to intubation, guys, just to be clear.
It's immediately apparent to me that this is a life-threatening situation.
Sid, can we plug in the nasal prongs, please? We need to put her in an induced coma and put her on the breathing machine, which would both stop any ongoing seizures and deliver the oxygen that she vitally needs to her organs. So let's try to optimize this oxygenation while we can. We think she's had no seizures for 2 years.
Every second counts.
All right, I'm just going to give her some to settle her down.
Try to relax for me.
Dr. Martin starts sedation.
Okay, dear. Try to relax for me.
All right, I'm just going to give her another 40 of propofol.
Cindy has to be stable before they can put her on life support.
Yeah.
Worked quite nicely.
There we go.
Look at that.
Ooh, oxygen's coming back up now.
Look at that for a blood pressure.
Brilliant. Thank you very much.
Finally, they've stopped Cindy's seizures. Dr. Michelle can now start to insert the breathing tube.
I'm happy to proceed, Martin. This is critical. She could die from this. All right, everybody ready?
Does it hurt when you swallow?
It's just
careful. The glass there.
Just on the left side.
75-year-old Hugh has nearly touched the shard of glass that's embedded in his neck after a serious cycling accident.
So, Hugh, thanks for trying to help out. Just so you know, there's a shard of something sticking out of your neck, so don't go feeling around there. Just
When Hugh is reaching across, my mind immediately is thinking there is a potential here that it may be accidentally knocked and dislodged.
If it moves, he could bleed to death.
Can you order me a scan and get me an angio? So, Manny, do you want to do the ultrasound of his chest and do the tummy?
Dr. Jonathan needs to make sure that Hugh doesn't have any hidden injuries before moving him to the CT scanner.
I'm just going to have a look at the ultrasound probe, okay?
People who've got a stab wound to the neck can sometimes puncture the lung or hurt some of the structures in the chest, so we have to make sure he hasn't done that as well. And I'm trying to rule out any other injuries while we're there. I think he's hit the jugular vein.
Oh.
Hi, it's Jonathan. Can I get a mobile chest and pelvis in trauma 1, please? Thanks, mate. Anything on ultrasound, Manny? So the left lung up, Manny, or not?
Yeah, lungs are up, sorry.
Lungs are up.
Yeah.
Hugh's lungs are working normally.
What I think we should do is put a bit of tape on the actual gauze that's holding the glass so it stays still. We're either going to have to hang on to the piece of glass or hold it in place. So I elect to try and tape it or at least stabilise it so it won't move, because any movement's going to make it worse.
While Jonathan's taping this piece of glass up, I am holding my breath.
Do you want to put something
No,
around it?
I'm just going to do this. Oh, I bumped the piece of glass and it moves. That's not good. Have to be very careful here that I don't actually dislodge it myself. The idea being that that shouldn't move too much. All right? You okay?
Yeah, I'm fine,
Yeah,
thank
good.
you.
All right.
Getting the required scans of Hugh's neck without touching the glass is extremely nerve-wracking.
Go right up to it, but don't touch it. Is it sitting in the vein?
It's important to look as closely as we can with the ultrasound probe. Potentially it gives us an indication of the depth of the injury. I'm very, very mindful of not inadvertently knocking on that shard, dislodging it and causing any greater damage.
Looks like it's moving.
Jonathan,
if you I'm trying to be really
No, it's all right. I just want to have a look. But that's the foreign body there. See that? There are things that can happen when glass or foreign bodies enter blood vessels. A piece of glass can actually get into the blood vessel, float upstream, and you could have a stroke. Oh, what's that?
Yeah.
What the hell's going on there?
Airport worker Cindy's had a series of life-threatening seizures.
We're definitely going to proceed to intubation, guys.
Dr. Michelle's about to put her on life support to take over her breathing.
Everybody ready? I'm going to have a look. Yeah. Perfect epiglottis, and I can see cords.
Now, Dr. Michelle inserts the breathing tube into the lungs.
Let's feed the tube over, please. You have the bougie. Good. Can you give me a bit of backwards? Yeah. A little bit more backwards if you can. If it's in the wrong hole, we might be pushing air into her stomach instead of her lungs. So it's a really critical point in that procedure where time seems to stand still. Excellent, that's over, bougie out. Good, and let's get cup up, perfect, and go ahead.
It's critical the tube is in exactly the right position.
So I am 22 at the lips. Have a CO2 trace, we have direct visualization. Would you mind just having a quick listen? I get Martin to listen to both sides of her chest to check to see that air is flowing equally into both sides. That sound all right?
You're in the right hole.
Yeah.
There's more air entry on the
On the right?
side than the left.
All right. Okay, ready? So, tube clamped.
They remove the manual pump. The machine takes over Cindy's breathing.
We just took off that end tidal from there, and it's going through over here.
The oxygen levels are coming up, but we need to check the state of the lungs, and the easiest way to do that is to get a chest X-ray.
Martin, did you get a hold of X-ray?
They promised me they're coming immediately.
Excellent, thank you. All right, well, it's maintaining. It's not going down. Excellent, hi.
X-ray.
Down here, and it's, yeah, we're in the right place.
Great. The tube is fine. It's like, yeah, well above the carina, so it's not down the right way.
Cindy is stabilised, but until they know why she's having seizures, her life is still at risk.
Yeah, X-ray looks great. I'm gonna book her a CT brain. The next step is to get a CT scan to see if we can see any changes on her brain that may have caused this to happen. All right, so we go all the way slowly on 3. 1, 2, 3. That's the way. We're having a look at her brain. We're making sure there are no bleeds on the brain or anything to suggest a tumor or a mass there.
Just looking to see if there was a big bleed or anything. 31. Still on 35. So there's nothing terribly exciting at the moment.
All good? Done? Thank you. Luckily for Cindy, there don't seem to be any abnormalities at first look. So for now, it looks okay. And we just need to go the next steps further to figure out what's caused Cindy to have all these seizures today. Well, she's definitely not out of the woods yet. Cindy's still critically unwell. She needs to be admitted to the intensive care unit where they can keep a close eye on her. It's up to the neurology doctors and the intensive care specialists to further manage and figure out what's caused Cindy to have all these seizures today and what can be done to prevent them in the future.
So this lady's in her bed now. We should just go have a look at her.
Emergency Dr. Scott Taylor is about to meet his next patient.
We're expecting a lady in her 90s who sounds like she's probably broken her hip or something around her hip. And we know that these sort of injuries are pretty good predictors of people dying within the next 48 hours. Hello there.
Hello.
Phyllis, I'm Scott, one of the doctors.
94-year-old Phyllis has fallen badly while getting out of the shower.
What do you remember happening?
I just fell.
Mm-hmm.
I went down so quick. Well, the older you are and the taller you are, the quicker you go down.
Phyllis has lived alone since her husband died 13 years ago.
Just have a look at your pelvis here. So this is the sore side, is it? It's sore in here?
Yeah, there.
Sore in there, okay.
Dr. Scott suspects she has a broken hip and a possible head injury.
Did you hit your head at all?
Don't think so, no.
Okay. You're conscious the whole time?
Yeah.
You saw anywhere other than your hip?
Just that whole leg.
The whole leg, okay. It's quite obvious after the initial assessment that she's either broken the neck of her femur or potentially the upper part of her femur below the hip joint. So how long did it take you to get to the phone?
Oh, God, I don't know. Yeah, well, I was squaring around my back.
Okay.
I only got the phone down on myself. I'm laying on the back on the floor. And I rang my brother.
Phyllis's brother Eric lives a 30-minute drive away.
Oh, it was the shock of her life because she rang me saying she had a fall and to see her laying there, and it makes you think.
Phyllis was trapped for 2 hours before Eric could let the paramedics in.
It's also possible that she's had some complications as a result of being on the floor for so long. Their muscles break down a little bit, which can cause some issues with their kidneys and their electrolytes and make them potentially really, really sick. You've got a bit of fluid in your knee as well.
No, they're very sticky knee.
Okay. Can you bend that knee at all? No, that's okay. That's okay. Is it because it hurts in your hip?
Hurts my knee.
Okay. We know these injuries can be catastrophic. They've got a high risk of having a complication like a pneumonia while they're in the hospital. Maybe that fluid in your knee is always there. I don't know.
Yeah.
But we'll get an X-ray of your thigh bone, your femur, and an X-ray of your knee. I think you're probably going to have a broken hip, and if it's not your hip, it's probably going to be the top part of your
your femur. If that's the case, either of those things are the case, you'll need an operation.
Oh, gee.
That's the foreign body there. Oh, what's that? What the hell's going on there?
Dr. Jonathan and Dr. Manny are performing an ultrasound on 75-year-old cyclist Hugh.
That's the common carotid.
A shard of glass sticking out of his neck after crashing into a van's back window.
That common carotid's got some weird stuff there.
The actual foreign body.
Okay.
Worried, pieces of glass have broken off the main shard and have entered the carotid artery in the neck.
You okay there?
Yeah.
Yeah, you're doing fine. If a projectile or a piece of glass gets into a blood vessel, it could actually be taken along for a ride in the flow of the blood vessel. It's called an embolism.
Those reflections we were seeing, I think, are reflections.
That little dot looks like when you put a central line wire through a vein.
But that's what we were seeing in the artery, though.
There may be shards of glass within the actual vessels themselves. And that's most alarming because if there are small pieces of foreign body material, they can act like a clot that causes stroke and travel up to the brain.
You ready for X-ray?
Yeah,
Yep.
yeah,
All right.
thanks.
X-ray.
Before moving Hugh to CT, Dr. Jonathan wants to make sure he has no other significant injuries.
You're saying that's the aorta?
Yeah. Oh, so there's no pneumothorax. The X-ray looks okay. We're going to do a scan, which will show us whether the glass is in the vein or not. If it's not in the vein and everything's all right, we'll be able to pull it out. But we'll still need to do a little operation to have a look and see what damage is done. All right? Are you feeling all right otherwise? Yeah. We want that bit of glass out pretty quick. We want to be in the operating theatre when it comes out. We need to get more information for the surgeons first, so we're going to go to the CT scan to work that out.
All right. No movement with your neck, okay? Ready? Okay, on three. 1, 2, 3.
Emergency nurse Ebony Butterworth has taken Hugh for a CT scan. He has a shard of glass embedded in his neck after a serious cycling accident. The team are worried the shard is in his carotid artery and that tiny fragments of glass have broken off and could cause Hugh to have a stroke at any moment.
He is very precarious right now. He's coming across as okay, but very obvious that things aren't normal.
We can see a funny reflection going on in the blood vessel. Does that mean there's glass actually in the blood vessel? We're not sure. I mean, the question is, what would you do if it happened to you? Would you pull it out?
You would have an initial instinct to pull it out, wouldn't you?
Yeah. I reckon I'd pull it out.
The CT scan reveals the glass has miraculously not severed his carotid artery.
Not in the vessel.
Not in the vessel?
The carotid's here.
Good.
It's anterior.
About 1 centimetre in?
Yeah.
Yeah.
Maybe 1.5.
Close.
It looks like it's right over the carotid sheath, which is a plane of tissue that holds the carotid artery and the carotid vein, and that's what I don't want it to be penetrating. That's the bit with tape sticking out, goes in. But there's more. There's other bits. Yeah,
Right,
that's
so
the broken off
there,
bits.
Which seems to go. And
That's the broken off bits.
then, I think these bits here,
Whoa.
they shouldn't be there.
This glass has gone in round that carotid sheath and fractured and is still okay. Pretty amazing stuff. That's the glass.
Yeah, so that shouldn't be there.
It's actually.
It's like around the sheath.
It's almost like it's.
It's gone around the carotid sheath. Oh my God. There's fragments way deeper beyond that. So we were right to be worried because the glass is right over that carotid sheath.
There's a concern that some of those pieces of glass may be sitting around a major vessel in your neck.
Hugh's remarkable. He maintains an absolutely calm and measured approach throughout. I can't even begin to imagine what must be going through his head. No doubt there's a level of fear and anxiety.
I think we're heading in the direction of needing to explore this in theatre, yeah? So that it's all done really safely.
He's going to need a pretty extensive, significant operation to explore and dig all the pieces of glass out.
You're fine, yeah. On 3. 1, 2, 3. Back 2, 3.
Hugh is immediately taken to surgery.
He's unlucky that he's had the accident, but he's lucky he's still with us, because if it was 1 centimetre further in, he might not be with us.
Taking a quick break, emergency Dr. Maya Cubitt is doing 2 things at once, as usual. Grabbing a bite to eat and trying to become an Australian.
I'm trying to, while I'm sitting here, I'm trying to organise my citizenship ceremony, which has been a nightmare. I had our citizenship approval, but I'm waiting for the ceremony so that it's official, but it's taken so far 7 months. I have to swear allegiance, and until I do that, I'm not Australian. So I remain New Zealander just for a little bit longer.
As Dr. Maya heads back down to the ED floor, her next case is on the way.
Royal Melbourne receiving.
Good evening, Royal Melbourne. We're coming to you with a 24-year-old female, 1 week post-tonsillectomy, currently with active bleeding. Her first name is Georgia.
So we've just had a call about a young woman who's coming in having had her tonsils removed, who's bleeding from the area at the back of her throat where the surgery happened. It's called a post-tonsillectomy bleed. It often happens at, sort of 5 to 7 days after surgery, but it can be a life-threatening situation. You all right? Can you get in?
24-year-old student Georgia was at home when she started bleeding heavily from her throat.
Who did your surgery? Which day?
It was last Tuesday.
Last Tuesday, okay. Why don't we just leave him there?
We had a whole other bucket at home as well, and then we had about 50 mils of just straight blood coming from her nose and her mouth.
Yeah.
The young psychology student is hemorrhaging.
You know what? I'm also going to give you this in your hand. You stick that sucker in your mouth and suck out some stuff out of there. Good one. One of the problems for Georgia is there's blood coming out, and if it doesn't come out the front, it'll go down potentially into her stomach or potentially into her airway, causing her trouble feeling like you're drowning.
If Georgia keeps losing blood, she'll go into shock. Dr. Maya prepares for the worst.
I just need to give you another needle on this side so that if we need to, we can give you a bit of blood in the hurry, okay?
Georgia was at home alone when the bleeding started. She called her mum, who then called 000.
She frightened the living daylights out of her, saying, she goes, oh, there's a lot of bleeding. I was panicking because she's so far away. Like, getting to her quickly is just, tricky. So that's why I called the ambulance, and thank goodness I did. She was actually quite hysterical on the phone to me, very panicked.
Good one.
I'll hold the bag, you won't give one.
Yeah, that's the way. You do it, because then you can guide where it needs to be. The paramedics have done a fabulous job of gaining her trust, of keeping her settled and putting her in a good position where the bleeding's coming forward and she's able to manage that.
How you doing? You're the most stupid person that I've seen this.
I don't really like how it feels. People smiling at me with blood dripping out of their mouth. It's like being on Halloween. We could definitely help with a costume at this point.
Dr. Maya urgently needs to see where the blood is coming from and if she can stop it.
Let me just have a look.
It's a bit bloody.
Yeah, I know, lovely. Big R.
Realising she can't stop the bleeding herself, Dr. Maya calls for the help of the emergency ear, nose and throat specialist.
Oh, hey, it's Maya here. There is quite a lot of ongoing blood loss. You got any other tricks up your sleeve while we're waiting? There's an enormous amount of blood that has come from her tonsil area. She's got bags of it with the paramedics. It's not a small problem. This is a big problem. You all right?
I'm going to wipe your chin again, all right?
Emergency ear, nose and throat specialist Dr. Cisco MacArthur has been called to help.
So things are a little bit less voluminous.
So this is a very dangerous situation. We're dealing with a bleeding airway. Georgia may actually be unable to breathe and suffocate on blood. I'm going to pick a little bit of the blood clot away, I think.
All right.
Yeah.
Gross, huh?
Yeah.
Pretty horrible stuff, yeah.
Imagine having his job. He has to look at snot all day.
Oh, yeah, that's, the head holes are pretty gross.
Sorry.
If Dr. Cisco can't stop the bleeding, she'll need urgent surgery.
Sorry if this makes you gag.
Yeah. There you go. Cisco has had a look and he's using cautery, so essentially like a matchstick, but the end is applied to the wet surface of the area at the back of George's throat that's bleeding, and it will cauterise or burn the area and create a clot where there wasn't one sitting there to try and plug the hole.
You've done really, really well there. You okay?
Yeah, just my lips are really wet.
It's honestly the best Halloween costume. At the moment, the bleeding seems to have settled and stopped with the cautery that Cisco's applied. What we need to do now is wait and see whether that clot holds. Hopefully it won't bleed again.
Hello.
Hey, sweetie.
At last, George's parents can be with her.
It was just very overwhelming because it just would not stop. I was just worried I was going to bleed out.
Oh, Leanne, it's Maya. I'm consultant for the patient in Resus 3 tonight.
Dr. Maya makes sure Georgia will be closely watched overnight in case the bleeding starts again.
They've got a 7 southeast bed that they've been holding on to for her, Cisco. So sorted, they're all over it. The risk, of course, is that the bleeding starts again. So if this is to happen again, Georgia is at risk of having another really big bleed. And we really need to keep her safe, make sure that we're prepared for the worst while hoping for the best. At the moment, we're all under control. She's safe, she's in the right place.
Yep.
And if things don't stay settled down, we have a plan,
yes.
But at the moment we don't need to use it.
Okay.
And fingers crossed we won't need to use it.
Okay, all right then. Please.
94-year-old Phyllis lay helpless on her bathroom floor after a shocking fall in the shower.
Just have a look at your pelvis here. So this is the sore side, is it? It's sore in here?
Yeah, there.
Sore in there, okay.
Dr. Scott suspects a bad break near her hip, which could be catastrophic for someone her age.
Can you lift that leg up towards the ceiling? No, that's okay. Can you bend your knee? And straight?
We've noticed some fluid around her knee, which has me concerned that there may be a second injury there. And it tells me that she's fallen pretty hard and probably sustained some pretty significant damage to have injuries of this nature to 2 different places.
I'm 94 and I've got all this time to do for myself, doing shopping and washing, house cleaning.
At 94, Phyllis manages to live happily on her own. This accident could change that forever. Her worst fear is losing her independence.
Yeah.
Any elderly patient that's fallen over, no matter how good they might have been before the injury, a lot of them actually die within the first 2 years after sustaining an injury like this.
What we can do to help your pain in the short term is we can give you an injection of some anaesthetic, and that targets the nerves around the hip. I'm going to go and organise a few things for you. So the rest of those x-rays, I'll come back with some equipment to do that injection, and then we'll use the ultrasound to find a good vein, okay? All right. We'll take good care of you, I promise. All right. I'll be back in a couple of minutes. Okay.
Dr. Scott needs to do blood tests to make sure Phyllis is okay if they need to operate on her leg.
We often use our ultrasound machine to help find veins in patients who may be difficult to put a drip in for whatever reason.
It's a bit of an awkward position because it's right where it crosses the elbow. So I'm right over the top of it.
Yep.
Sharp sting.
These veins can be quite mobile, so you really need to pin them down, the veins, that is, not the patient. But the veins tend to roll around a little bit.
Are you getting any?
Yeah, getting plenty.
Oh, at last.
Cool. All right, so we've got all the blood we need. We'll get you off for your scans very shortly.
If Phyllis needs an operation, the risks are high. She may not survive.
All right, we'll be back in once your x-rays are done.
Just tilt chin up the skull a little bit. That's perfect. Thank you.
So injuries of this magnitude, we worry about people having low bone density, and that's certainly not unusual in elderly females. We know that their bones break much more easily.
Hold there. Breathe normally, Phyllis.
Oh, yeah. Now, Dr. Scott can finally see how badly damaged Phyllis's leg is.
Unfortunately, Phyllis has got a pretty nasty fracture of her femur, so her thigh bone. So it's broken up the top around the hip joint. It's also broken just below that at the top part of the femur.
I'm really worried about the bad news that I'm going to have to deliver to Phyllis. She's got 2 pretty nasty fractures. Even just one of those fractures on their own is something that's life-altering for a lot of people. It may be that she doesn't quite get back to her level of independence that she was before the accident. It's also quite possible that she may run into some complications while she's in the hospital or recovering, which certainly may be life-altering or life-ending, unfortunately.
All right, Phyllis. Hey, you've got a pretty nasty break in your hip. So it's through the top part of the hip, and then it's to the top of your thigh bone as well. So there's a couple of separate breaks there. And it looks like there's a breakdown near your knee as well. An operation's definitely in order. It's just how much metal it's going to need and where that metal's actually going to go.
Oh, do your best.
I'm really sorry.
Phyllis is going to need some pretty extensive input from here in the form of surgery and physiotherapy and occupational therapy, nursing care, which has the potential to take a toll on her, both from a physical point of view, but also from an emotional point of view. And somebody who's been very independent, very active up until this point of their life, that can be very confronting.
Oh, I knew I broke something so that it fell. I didn't have to be told.
She's going to have a long recovery ahead of her, assuming that everything goes to plan from here and that she doesn't run into any problems.
I know there's people worse off, and I'm feeling sorry for myself at the moment.
Martin, it's Michelle. I need help in Resource 6.
Busy mother of 2 Cindy was losing oxygen after she collapsed at home while having seizures.
We're definitely going to proceed to intubation, guys.
Dr. Michelle needed to put her on a breathing machine and scan her brain looking for the cause.
Just looking to see if there was a big bleed or anything.
Well, she's definitely not out of the woods yet.
Cindy went to intensive care to be monitored before going home. 2 months later, she's still seeing specialists to find the cause of her illness and very grateful for the care she received at the Royal Melbourne. A day before she was to begin university, psychology student Georgia was rushed to emergency, hemorrhaging after having her tonsils removed.
People smiling at me with blood dripping out of their mouth. It's like being on Halloween.
Doctors managed to stop the bleeding and helped Georgia through a terrifying episode.
Just made me feel really nice and just comfortable.
After a night in hospital, Georgia went home. 2 weeks later, the bleeding started again and she needed surgery. She's now back at uni, fully recovered. 75-year-old cyclist Hugh collided with a van and came into emergency with a shard of glass embedded in his neck.
You've got this little thing sticking in your neck and it might have hit the vein. If the piece of glass comes out and it's actually sitting in the artery and plugging the artery and it falls out, he will just bleed like stink out of his neck and he could be dead within minutes.
A CT scan confirmed Hugh needed immediate surgery.
That's the glass.
Yeah, so that shouldn't be there.
Oh my God.
Surgeons removed the glass and Hugh went home 5 days later.
I had just the one operation where they removed all the bits of glass and there were about 35, 36 stitches down the left side of my neck, and it's actually healed up brilliantly. The surgeons were remarkable.
Just in time for a cuppa.
Yeah.
Well timed.
Well timed.
Hugh is grateful for the help of strangers.
When the accident happened, a tradie pulled up and rang the police and the ambulance and helped me to sit on the curb. And then a couple of other tradies pulled up as well, and I have no idea who they were, so I haven't been able to thank them or whatever, but they were really very caring and first-rate people.
The accident hasn't stopped him doing what he loves.
I've been back on the bike for about 4 weeks, had a couple of 70-kilometre rides recently. I couldn't fault the treatment and care I received.
94-year-old Phyllis arrived in emergency after falling in her shower and fracturing her hip.
An operation's definitely in order. It's just how much metal it's going to need and where that metal's actually going to go.
Do your best.
I'm really sorry.
Dr. Scott feared for Phyllis's future.
She's got 2 pretty nasty fractures, which certainly may be life-altering or life-ending, unfortunately.
After a major hip operation and 5 weeks in rehab, Phyllis is back on her feet and living with her brother Eric.
I spent a lot of time in bed for quite a while. I got stronger, but when I came home, Eric had to do a lot of things for me. I'm pretty good now, and I can walk.
Phyllis is determined to keep improving.
I can make a cup of tea. I do have to be cooking. In the afternoons, I do watch the television. A, B, A. Come on.
Yeah.
Come on, tell her that's it. You've got it right, Eric. Each day, I'm getting more independent, which is good. Just make the best of what I've got left. That's all I can do.